Good morning. We are going to address these diseases from the Department of Health, the Unit of Infectious Diseases. And today I would like to welcome you to this virtual seminar on yellow fever. One of the topics that now is having an important impact in the region, because there is no doubt that yellow fever was one of the diseases with the greatest impact, not only for humankind, but also historically. And it is definitely an important challenge for public health in the Americas, with a great potential for serious outbreaks, as we saw many years ago in Brazil, but also in areas with low vaccination coverage, considering also other vectors, because there is no specific treatment for the prevention other than the vaccination. That's why the prevention of outbreaks is fundamental to guarantee a fast response, which is also going to be essential to prevent reemergence of the disease in the region, but especially to work from our organization to prevent this disease, and also to protect the population of a lethal disease that can be preventable. That's why we thought about organizing this webinar, so that you can have an update overview of the situation in our region. As you could see in the agenda, we have a very hectic agenda, because we wanted to cover all the topics that are important for the response to yellow fever in our region. We have a good group of specialists in the different areas of yellow fever. Well, with no more, I would like to give the floor to our speakers, but I would like to remind you that we have a simultaneous interpretation into English, Spanish, and Portuguese, so that our speakers feel more comfortable, and also to help all the participants to listen to our webinar in their preferred language. And also, please, if you have any question, you can use the Q&A section that you will see at the bottom of your screen. And also, at the end of the webinar, we are going to take some time to answer some of the questions and to have a discussion. And now we are going to start. I would like to say also that we have a special guest, and no doubt he is one of the persons who knows the most about yellow fever. We share this passion. That's why I wanted to invite him to this introduction. Dr. Silva Lieri, maybe you all know him. He is the director of the Department of Transmittable Diseases in PAHO in Washington, and Communicable Diseases, Department of Communicable Diseases in Washington. And this is a topic we all share, and he knows about it. Sylvain, please, you have the floor.
Muy bien, gracias, Jairo.
Well, thank you, Jairo.
Voy a pedir
I'm going to ask you, please, to confirm if you can see my screen.
Muy bien, colegas. Es un gusto,
Okay, colleagues, it's a pleasure to be with you today to open this webinar with a recent history perspective, the most updated information is going to follow my brief introduction or presentation. Although I am from a different continent, I know very well, and it is in my genes, that yellow fever was associated to the Americans since more than 500 years ago. 500 years ago. We can
de manera muy, muy estrecha las
link.
epidemias de fiebre
We are
amarilla
very linked
con el
to
desarrollo humano, la colonización
the
y los
yellow fever
aspectos
epidemics, the
de
colonization,
desarrollo
the
rural y
aspects
desarrollo
of rural
económico
development and
de este
economic
continente.
development of this
Ah,
continent.
hasta finales del siglo XIX, la fiebre amarilla
Towards the end
estaba
of the
en todos
19th
los puertos,
century,
en todas
the
las
yellow
ciudades
fever
mayores
disease
costeras
was
y
present in all the
ciudades
ports, all the
con una
coastal
altura de menos de
cities, in
1900
the
metros
highest cities with
arriba
a
del nivel del mar.
height of less
Y
than 900 meters
realmente
above the sea level,
ha
and
sido uno de
it
las
was
limitantes más
one of the
importantes en el
most
desarrollo humano
important
y económico
limitations for human and
de nuestro
economic
continente.
development in our continent.
Pero yo no voy a
But
pesar 5 años
I am not going to
atrás. Vamos a iniciar con el final del siglo XIX
think about
y con
this
la,
500
la- la-
years
la- la
ago. We are going
fundamental
to start
comunicación de
with
Carlos J. Finlay
the
a la
uh,
Academia de
19th
Ciencias de La Habana
century
en
Carlos J.
1886,
Finlay, the
que decía
Academy of
básicamente en una
Sciences. He
frase,
basically
el
said
mosquito
in a
hipotéticamente
statement, the
considerado como agente de
mosquito
transmisión de la
hypothetically
fiebre
considered
amarilla.
as
Después
transmission
de
agent
muchas
of a yellow
hipótesis,
fever.
casi de
After
hipótesis de la Edad
many
Media sobre el vómito
assumptions
negro,
made
teníamos un
on the
científico
uh,
que había
black
demostrado
mosquito,
y
we had a
amenazado y ha puesto las
scientist who
bases
had
de
shown, who
demostración
had
de la
set
transmisión vectorial
the
por Aedes
foundations
aegypti.
for demonstrating this
Durante casi 20
transmission.
años,
During around
el mundo
20
científico
years, the
peleó para
scientific world
confirmar eso. Para mí, todo estaba en su
confirmed this.
comunicación
And for
y
me,
es
everything
únicamente en
was in
1902 con el
line.
trabajo del
And
BOB
in
en Cuba
1902,
y la intervención de Gorgas
in
y de
with work
otros
in Cuba, the
científicos que se
in
logró demostrar la
group
hipótesis
of
de Carlos
scientists
J. Finlay.
from
Pero
Georgia and
realmente
other
es una
assumptions,
enfermedad
this
caracterizada
assumption was
en
demonstrated,
las
but this is
Américas
in
por
fact a
personas
disease that was
originarias de raza de
characterized
Andes.
in
Y
the
vamos a
Americas by
seguir
people
con
that
el
are
siguiente.
from the
Carlos J.
Americas. And
Finlay
now we are going to,
es un monumento de las
we
ciencias de
can
este
say
continente.
that Carlos J. Finlay is a
Hay otra
monument
persona
for
que
science in this
tenemos
field.
que
We have one more
poner en una
person
pantalla
that
grande
we should
científica y
highlight
también
in
de
terms of
operaciones
his
es Fred
scientific
Soper.
work, Fritz
Fred
Super.
Soper
Fritz
trabajó en
Super
Brasil
worked in
inicialmente
Brazil, initially in Brazil,
luchando contra la introducción de anófeles
fighting
gaudí desde el
against
África en
the
algunos estados de
introduction
Brasil
of
y después
this
su
virus
asociación con
in
la
Africa
Fundación
and some
Rockefeller
states in
hizo que
Brazil.
Fred
And
Soper estuvo
Fred
enfrente
Soper was
de la respuesta a
in
los
the
brotes
front
de fiebre
line
amarilla
in the
y la
response to
caracterización
the yellow fever
científica
and the
de la
scientific
fiebre amarilla
characterization of
y de los
yellow
ciclos de
fever
fiebre amarilla.
and the
Hasta
yellow
este
fever
entonces, la fiebre
cycles.
amarilla
So
era
far,
considerada como
yellow
una
fever was
enfermedad urbana
considered or an
transmitida
urban
por Aedes aegypti.
disease that was
Pero en
transmitted by Aedes
1933,
aegypti.
Fred
But
Soper
in
logró demostrar la
1903,
existencia de otro
Fred
ciclo de
Soper
transmisión. Y es su famosa comunicación
demonstrated
en
the
inglés,
existence as a
Yellow
different
Fever
of a
Without
different
Aedes
transmission
aegypti.
cycle, yellow fever without Aedes
Y eso se
aegypti.
demostró en el
And
Valle
this
de
was
Canadá,
demonstrated
en el
in
estado de
the
Espíritu Santo,
Canaan
en
Valley,
Brasil,
in
donde
the
realmente
Espírito
en
Santo
comunidades
state in
precisas, con una
Brazil,
encuesta muy
where
estricta, Fred Soper
there were
logró demostrar
surveys
que había
in
otro
specific
ciclo de
communities, and
transmisión,
Fred Soper
además de la
was able
transmisión
to
urbana
show that
por
there
Aedes
was a
aegypti.
different transmission
Y
cycle
para mí eso
besides
es fundamental.
the urban
Y
transmission,
un
and this is
poco,
fundamental for
un par
me.
de años después,
And a couple of years
tuvimos
later, we
esa,
had
ah,
this
esa prueba de terreno de esas
this
grandes
field
ondas hiposóticas
testing
y de
with these
casos
great
relacionados
waves,
a la transmisión
hypothetical
selvática
waves
de la
related
fiebre
to
amarilla.
the
Eso es
wild transmission of yellow
un
fever.
mapa que ha sido publicado en
This is a map that was
1951 por
published
Trott,
in
pero que representa
1951 by Ford,
el
but
frente de
it
progresión de la fiebre
represents
amarilla
the
selvática
progression
en
of
Brasil, en el
the
sureste de
wild yellow
Brasil,
fever in Brazil, in the
entre
southeast of Brazil, between
1933 y 1940. Eso también es
1933 and
fundamental.
1940.
Es
This is
cómo hemos
essential
visto en algunos
information
ecosistemas
because,
de
as
este
we saw
continente,
in some ecosystems
extensas
of
ondas
this continent,
episóticas
there
a
were
lo
large
largo de
episodic
los corredores
waves
selváticos de la Mata
along
Atlántica de
the
Brasil, en
jungle
este caso,
corridors of the
con
Atlantic jungle
nuestros
in Brazil, in
indicadores,
this
nuestros
case,
mejores
with
aliados,
these
los primates
indicators,
no humanos y
the
especialmente
non-primate
al guata.
humans.
Y, pero lo que
were
Es
especially
muy
important
importante y que
here.
voy a
But what
repetir al menos
is
dos veces
also very
en
important that I
esa
am going
corta
to
presentación es
maybe
que
mention
la historia se
twice in this
repite.
brief presentation
Y
is that
ustedes miran el sureste de
the
Brasil
history
como una
is repeated.
episódica
You see the
entre
southeast of Brazil
1934 y
with this episodic
1940. Y este
history
mapa es un mapa
between
interno de la OPS, es así bien
1933 and
publicado en
1940, and this is a map that
los
was published by
informes de
PAHO
situación en
in the
2017.
situation reports
La
in
historia se está repitiendo.
2017. And we see that the
Eso
history
es
is
la
being
situación en
repeated.
el
And
sureste de
this is
Brasil
the situation
entre
in the
diciembre de
southeast
2016
of
y
Brazil
mayo
between
2017,
December
con largas, extensas
2016
ondas
and May
episódicas en
2017 with large
exactamente las
episodic
mismas
waves,
zonas, a
the
pesar de
same
cambios de
areas,
ecosistemas
although we
importantes y, por
have
supuesto,
important
de una
changes in the
densidad
ecosystems
humana y de un
and,
frente
of
de
course,
colonización
a
agrícola
change also
mucho
in
más
the
importante.
demographic density.
Pero, ¿qué hizo el trabajo
But
de Fred Soper? Y
what
eso,
was
otra
the
vez, es un
impact of
mapa
the
que ha sido
Fred Soper work?
publicado
This
por
is
Fred
again a
Soper
map that
en
was published by Fred Soper in
1963, cuando Fred Soper
1963 when
era
he
el director
was
de
the
la Oficina
director
Sanitaria
of
Panamericana,
the
que
Pan
ahora se
American
llama
Health
la
Office that
Organización
is now
Panamericana de la
called
Salud.
the Pan American
Otra
Health
vez, un científico,
Organization.
es un honor
Again, a
trabajar en la misma
scientist,
organización que él. Pero lo que podemos ver
he's an
es que
important
ahora,
scientist.
como
I am very honored to
el
work
cambio de
in the
paradigma
same
es que
organization
estamos
he was
hablando
working
de
in. But the change of
brotes
paradigm here is that
de
we
fiebre
are talking
amarilla
about
humanos
yellow fever outbreaks, urban
reintroducidos a
outbreaks
través de
that
un
were
reservorio
introduced,
selvático.
reintroduced
Y
through a
el
jungle
mapa
or wild
presenta entre
development. The map
1942
here is
y
the representation of the
1960
situation placed
los
between
brotes.
1942 and 2008.
1954,
And
exactamente.
here we are talking about
Destacar en este momento los últimos brotes
the
transmitidos
outbreaks.
por
I would like to
fiebre por
highlight
Aedes
here the
aegypti en
outbreaks
el estado de
by
Acre
Aedes
en
aegypti in the
1942,
Acre
en
state in
la ciudad de San
1942,
Fernando,
in
isla de
San
Trinidad,
Fernando,
República de
in
Trinidad y
the
Tobago, en
Trinidad and
1954
Tobago
y
Island in
posiblemente en Asunción, Paraguay,
1954, and
en
maybe
en
also
2008.
in Asunción, Paraguay in
Mi mensaje
2008.
es que el riesgo de
My message
urbanización
here is
siempre
that there
está
is always a
presente.
risk of
Siempre, siempre,
urbanization.
siempre. Los
Always,
mecanismos de
always, always. The
interfacia entre
mechanisms
ciclo
of
urbano
this
y
interface
ciclo
between the urban
selvático y
cycle
también ciclo
and the
periurbano
jungle
es la
cycle or
clave ahora de
peri-urban
nuestro
cycle
pensamiento. Pero por
is
supuesto, lo que no olvide
should be
decir, ¿cómo
now in
hemos
our
llegado
minds.
a una
But the question
situación
is,
de una fiebre
how
amarilla
did
endémica
we
en
achieve to
todos los
this
territorios
pandemic
de la zona
situation of yellow
intertropical de
fever
las
in all
Américas? Es
the
gracias a la vacuna
tropical
y el desarrollo de la
areas in the
vacuna
Americas.
durante los
And
años
thanks to the
1930
development of
por
the
Max
vaccine
Taylor, quien
during
era un virólogo surafricano y
during the
recibió el premio Nobel para
1930s, he
sus pesquisas
Max
en
Taylor, he received a
1950.
virologist, he received
Pero
a
siempre con
Nobel
esa
Prize
noción de
due
una
to
posible
his
reintroducción a
research,
través
but
de
always with a
ciclos
potential introduction
selváticos.
through
Y eso es
jungle
el ejemplo de
cycles.
Brasil.
And
Todas
this
estas
is the
fotos son,
example
casi
of
todas
Brazil.
estas
All
fotos
these
son
pictures,
fotos
all most
muy
of these
personales
pictures are
y
personal
de nuestro
pictures,
equipo durante el
pictures that
apoyo a
were
las
taken by
autoridades de
our
Brasil,
team
estados,
with the
municipios a
support
nivel
of the
federal
Brazilian
en
authorities.
2017,
Here
18
they
y
are showing
19
the
y hasta el
different
día de
states
hoy
in
estamos llevando
2017,
esa
2018,
onda
and
episódica que estoy
today
seguro que
we
los
are
colegas
still
van a presentar.
observing these
Lo que
zoonotic
quiero representar con esas
exotic
fotos es
situations.
realmente
What I
esa
would like to show
interfase
in these
con los
pictures is the
ecosistemas
interface
selváticos en la
with
parte
the
izquierda de la
selvatic
diapositiva y
ecosystems to
los
your
ecosistemas
left and
periurbanos o
the
averurbanos,
peri-urban
en este caso,
ecosystems
con
to your right. In this
primates no
case,
humanos
with
diferentes, aluata
non-human
en focos
primates
selváticos en una dinámica
in
selvática,
jungle areas,
pero
in jungle
el
dynamics,
caritrix en zonas
the
periurbanas y
characteristics
urbanas.
in
Y esas
peri-urban and
fotos son de
urban
dos estados,
areas.
Minas
And these
Gerais y
pictures
el estado
are
de Espíritu
from Minas
Santo, que es
Gerais and
donde se
Espírito
ha
Santo
comprobado
states,
la transmisión.
where the transmission
Ah,
was
última
proven.
diapositiva.
This is
Es
my
que
last slide.
en aspectos de fiebre amarilla,
In
la
relation to
historia
yellow
se
fever, the
repite
history
en las
is
Américas.
repeated over and
Estamos
over
hablando,
in the
yo he
Americas. And here we
presentado en
are
mi
now talking
segunda diapositiva, creo,
about
el trabajo de
what
Fred Soper en
was presented
1933
in my second slide, the
sobre la
work of Fred
transmisión
Soper
sin
in
Aedes aegypti
about the
en
transmission
2017.
without Aedes
exactamente en
aegypti,
los mismos lugares del Valle de Canaán, Espíritu Santo,
exactly
las
the
mismas
same
comunidades,
as in the
se
Canaan Valley,
presentaron
Espiritu Santo.
brotes
The same
selváticos
communities had
en esa
these
zona, transmitidos, por
selvatic
supuesto,
outbreaks
por
that were
hemagogus
transmitted
y o
by
zaretes. So, es mi
Hemagogos
último
Ansaretes.
mensaje
This is my
y
last
quisiera agradecer
message, and I would like to
El doctor Jairo
thank
Méndez Rico y todos
Dr.
los
Jairo
colegas que van a
Mendes Rico
presentar
and all our
por
colleagues
darme la
here who are
oportunidad
going
de
to have their
tocar
presentation for this
aspectos
opportunity to
históricos
address
al
historical
inicio de este
aspects
muy
related to the yellow
importante webinar.
fever at the
Muchísimas
very
gracias.
beginning of this webinar. Thank you
Muchísimas
very much.
gracias, Silván.
Thank
Definitivamente
you, Sylvain.
esa perspectiva histórica es
This
absolutamente
is a
relevante en este
historical
momento
perspective that
y
is
algo
relevant now.
que me parece
And
fundamental en tu
something
reflexión
that
es uno,
might
pues la
seem
historia tiende a
fundamental in your
repetirse y la
presentation
copia
is that
amarilla tenemos
history
que estar
usually
preparados
repeats
precisamente
itself.
por
And
eso.
for yellow fever,
Y la
we
segunda, que
need to be prepared.
definitivamente el
And the
riesgo
second thing is that
de
the risk
urbanización está
of
latente y que
urbanization
podría,
is
y
present,
definitivamente
and
es lo que podría llegar a generar unos
it could
brotes de un
generate
impacto sin
some
precedentes. Entonces, definitivamente conocer la historia es
important
absolutamente
impacts.
necesario.
It is definitely important
Muchísimas
to
gracias,
know
Silván, por ese
about the
abrebocas y ahora
history.
vamos entonces
Sylvain,
a ver
thank you very
precisamente
much for
muchos de los
this
aspectos que tú has
introduction. Now we
mencionado
are going to see all the aspects you
de
were
una manera un poco más
mentioning, but
desglosada.
now
Y
in
para
a
empezar
more
entonces vamos
disaggregated manner.
a
Now
revisar
we are going
la
to
situación regional
organize,
de fiebre
to
amarilla,
see the
seguida
organization
de
of this
dos
regional situation.
las charlas de dos países
We are
donde
going to
tenemos en
have
este momento brotes
two
activos,
presentations by two
principalmente, y
countries
que
where
son
we
clave en
have
este momento para
active
entender lo que está
outbreaks,
sucediendo.
and this is
Por
key
eso
to
entonces, para
understand
esta primera
what
parte,
is
para
happening.
una
For this
introducción sobre
first
la
section, we are
situación de
going to
fiebre
have an
amarilla a
introduction
nivel regional,
on the yellow fever
tenemos al doctor
situation at
Andrea
regional level. We
Vicari. El
have
doctor
Dr.
Vicari es el
Andrea
jefe de la
Vicari.
unidad
Dr. Andrea
Gestión
Vicari,
de
he is
Amenazas
the chief
Infecciosas
of the
del
unit of
Departamento de
infectious
Emergencias en Salud de
diseases
OPS
from the
acá en
PAHO
Washington,
department
y nos va a
here in
hablar
Washington,
precisamente de esa
and he's
situación.
going to
Entonces,
talk about this
Andrea, por favor, tiene la
situation.
palabra.
Andrea, please, you have the floor.
Buenos
Good
días a todos. Muchísimas
morning.
gracias,
Good
Jairo,
morning.
por la
Thank you,
introducción
Jairo,
también.
for
Espero
the
que puedan ver mis
introduction.
láminas
I
bien.
hope you can
Y
see
entonces
well my
empezaría sin
slides.
duda.
Okay,
Muy
I
bien.
am going to start
Perfecto.
my
No, nada más
presentation.
para destacar
Well,
que
I would like
obviamente
to
cuando
highlight
hablamos de
here that when we
fiebre
talk
amarilla hablamos de
about
uno
yellow
de los
fever,
tantos
we are
flavivirus que
talking
tenemos
about
que
one of the
lidiar con,
many
¿no? Y se trata
flavivirus
realmente
we
de una
need to
familia de virus que son
address.
bastante
This
críticos en
is
el
a
sentido
family of
que
viruses
tienen manifestaciones
that
o también
has
aparecen o
manifestations
tienen
or
ciclos bastante distintos, ¿no?
different
Entonces,
cycles.
aquí, por ejemplo, vemos, ¿no?
Here,
el,
for
el virus
example,
del
we
Nilos que
have
tiene
the
un
West
reservorio
Nile
más
virus
en aquello que
with
son aves, en la
a
transmisión por
reservoir in
vectores pues
birds
son más
and
silváticos.
the
Tenemos
transmission
después
by
Zika y dengue, que
wild
son dos virus,
vectors,
obviamente, que
Zika,
son muy
dengue.
antropogénicos, están
These
muy,
are
se
Zika virus
relacionan nada
and
más en un
dengue
ciclo entre
virus.
humanos y
These
creo que son
are
realmente
related
a
in a
especie de
human
Aedes.
to a
Finalmente,
human
fiebre
cycle.
amarilla,
And
¿no?
finally, yellow
Que
fever
tiene un poco la
virus
componente de ambos de los
with
dos
a
virus
component of
precedentes,
both
de los otros flavivirus que acabamos de
virus, the
mencionar.
fibervirus that we have already
Obviamente hay estos dos
mentioned.
ciclos
Obviously,
de
these two
transmisión que están
cycles,
siempre
these
también
two
en el libro de
transmission
texto
cycles
mencionado,
that are
aquello que es
also
la
mentioned
transmisión
in the
selvática o
text
aquello
in
que es la
relation to
transmisión urbana.
jungle
Y
or
aquello que se
selvatic transmission and
distingue
urban
esencialmente en este dos
transmission.
tipos de ciclo, por
What
un lado, el
we
lado
can
izquierdo,
highlight
aquello que es
here to
la
your
transmisión en
left
el ciclo
is the
selvático,
cycle, the
esencialmente donde
jungle or
hay
selvatic
mosquitos,
cycle, where we have the
especies
mosquitoes,
selváticas,
we
hemagogos y
have the
zaretes, como
wild
ya el doctor
species,
Lidia ha
we have
mencionado,
the
que
imagogous
básicamente hacen de
species, as
vector
the doctor
entre lo que son
said,
poblaciones
and here they
de
have the
primatas no
transmission from vector
humanos,
to vector
que
in
básicamente son los
these are
huéspedes
populations,
amplificadores.
non-human primate
Del otro lado, tenemos
populations.
aquí lo que es el ciclo
They are
urbano,
basically the
que
hosts.
transmisión
And
de
on the
persona a
other
persona, donde
side, we have
los
the
seres
transmission
humanos
from
son los
person to person,
seres
where human
amplificadores
beings are
por
the
básicamente
amplifier
mosquitos de la
beings
especie Aedes
for the
aegypti.
Aedes
Obviamente
aegyptis
también hay la
mosquitoes.
posibilidad que
Of
humanos
course, there is
entren
also
en
the
aquello que es
possibility
en
of
la
human
selva
beings
y se
to
contaminen ahí
go
también
into the
como
jungle
de
and
alguna manera como
also
huésped
get infected
ocasional,
as
y
hosts,
seguramente eso es la
as
mayoría de
occasional
los casos
host.
que hemos
And this is
visto
maybe
en
most
las
of
Américas
cases that
a
we
lo
were
largo de
able
los
to
años, no
observe in the
necesariamente
American
en
along the
términos
years,
de número.
not necessarily in
Como el
terms
de
of
ya
numbers.
mencionado, ¿no? Que lo
And
que es un poco
here,
históricamente, un
this
poco
was already
también
mentioned. This is about the history
el carácter romántico quizá
and
de
also
esta enfermedad, con
maybe
grandes
the
brotes
romantic feature of
urbanos,
this
¿no? Este
disease
es quizá un
with a
ejemplo muy bien
great
documentado del
urban
final del
outbreaks.
siglo
This is an
XVIII en
example that was very
Filadelfia,
well
donde ven
documented
básicamente
in the
aquello que
18th
es
century
realmente
in
cómo
Philadelphia,
esta
where we can
enfermedad ha
see how
matado,
this
mata
disease
a
killed and is
muchísimas
killing
personas, ¿no?
many people.
En su momento. Ven mortalidades, esas no son
You can see
letalidades,
here
esas son
the
mortalidades de hasta el
mortalities
60, de dos terceras partes de las personas que vivían en Filadelfia en el
of
1900, en el
two-thirds of people who lived
1793.
in
De hecho,
Philadelphia
mucha gente
in the
escapó de
19th
la
century.
ciudad que en
In
ese
fact,
momento
a
era
lot of people
aún la
escaped
capital de
the
Estados
city
Unidos.
to go to a capital city in the
Pero
United
la verdad
States.
es que ya se
But the
mencionó,
truth
no hay
is that,
verdaderamente
as
evidencia
it
que
was
en los últimos
mentioned, there is
80
no
años hayan
evidence
habido
that in the last 80 years
brotes urbanos
we
en el
had
censo
urban
clásico
outbreaks in the
de la fiebre
classical
amarilla en las
census
Américas.
of yellow
Sí, se
fever in the
describe
Americas.
en una publicación
It
una
is
posible brote urbano en
described
Santa Cruz,
in a
Bolivia, entre
publication as a
diciembre del
potential
97
urban
a
outbreak in
junio del
Santa Cruz,
98, pero
Bolivia
la
from
verdad que entre
December
los 6 casos, también 4 de hecho
1997
tenían una
to
historia de viaje.
1998.
Otra instancia que se ha
And another
publicado
case that was
es
also
el
published
brote
is the
posiblemente en el área metropolitana de
potential
Asunción del
outbreak, maybe in the
2008,
metropolitan area
donde
in
se
Asunción in
reportaron 9 casos de
2008,
tres muertes,
where
pero
9
nunca
cases
realmente
were
se pudo
reported, but we
identificar
were
el virus de
actually
la fiebre
never able
amarilla
to
en
identify
Aedes,
the yellow
básicamente porque ya
fever
se habían tomado
virus
acciones de control de
because
vectores muy importantes
specific
que
actions for
evitaban
vector
posiblemente
control
realmente
were
de
already
poder
taken
evidenciar
to
transmisión
prevent this
en el
outbreak,
censo clásico
and we were not
de
able to
transmisión de ciclo de urbano.
identify the
Esto
transmission
es
in the
básicamente
classical
la
urban
ocurrencia de
cycle.
los casos de confirmado de
And
fiebre
this is
amarilla en las
the
Américas
occurrence of
desde
confirmed cases of
1960
yellow fever in the Americas
hasta
from
a
1960
nuestros días.
to
Y
our
ustedes ven básicamente aquello que
days.
son
And
los
here you
13
can see
países que
basically the
generalmente
13
decimos que son
countries,
endémicos, ¿no?
and we
Y aquí
usually
quizá
say that these
debemos
are endemic countries.
repensar
And
un poco
here
esta
maybe we
definición
need
de
to think
endémico, ¿no?
about this
Porque realmente
definition
aquello
of
que
being
mantiene
endemic,
el
because
virus, digamos, no
usually
son
this is
ciclos
what
endémicos que
keeps
por
the
definición son de
virus.
transmisión
And
de persona a
this
persona
is
o entre
not
las
an
personas,
endemic
más son
cycle
realmente
because the
más bien
transmission is
ciclos
usually from person
enzóticos,
to
¿no?
person.
Y
These are
debemos
then
realmente quizá hablar
exotic
de países
cycles.
que
We
son
should maybe talk
exóticos
about exotic countries
en
in
nuestra región más que
our
verdaderamente de
region
endémico. Sin
more
embargo,
than
aquí ven en
endemic, rather
particular
than
algunos
endemic
países,
countries. And
Bolivia,
here we can see
Brasil,
some
Colombia
specific
y
countries, Bolivia,
Perú, que
Brazil,
son quizá
Colombia,
los
Peru,
países que han
that are
tenido
maybe
más
the
casos.
countries
La
with
mayoría de
the
estos
highest
casos,
number of cases.
excepto
Most of these
quizá por el
cases,
periodo de
except maybe for the period of
2016-2019, son verdaderamente
2016,
casos de
2019, are
trabajadores
cases
agrícolas, por ejemplo, o
related to
forestales que
farmers
se van
or
en la
forest
selva y se
workers who go to
contagian en
the
la selva
jungle
y
and get
después
infected in the
finalmente
jungle,
no hay
and then
verdaderamente
finally
transmisión
there is
en
not
sectores
really a
cercanos
transmission
a los urbes
in
de este sentido. Excepto
sectors that
seguramente
are
este
close
periodo del
to the urban
2016-2019 que ya
cities,
vamos a ver
except for
más
the
en
period
detalle en 2
2016 and
minutos y
2019
tal
that
vez
we are going to see in
seguramente
more
también los
detail in two
colegas de
minutes, and
Brasil
maybe
seguramente
also our
tocarán.
colleagues from Brazil are also
Esta
going
es
to
la situación
mention
más
about this.
reciente,
This is the situation, the most recent
2024-2029, y
situation,
ven básicamente un
2024,
poco también la
2025, and
preocupación
here you
y
can see
también la razón
maybe also
finalmente de
reflected
por qué hoy
the
estamos
concern and
hablando de
also
fiebre
maybe the
amarilla, ¿no?
reason why we
En el
are now addressing the
2024,
yellow fever here in
básicamente,
this
ya
webinar.
un
In
número de casos un
2024, there
poco,
was
quizá
a
tal vez un poco
case,
más
a
incrementado
number
respecto a los
of
años anteriores
cases, an
en
increased
5
number of
países,
cases
pero seguramente a
compared to
partir,
previous
sobre
years
todo,
in the
yo
five
creo que al
countries,
final del
but this
2024,
is
en las últimas
also
semanas,
seen
empezamos a ver
by the end of
verdaderamente un aumento de
2024,
casos,
where we
¿no?
see an
Y
increase
eso
of
es, ven
cases.
también la
And
distribución, aquí lo que
this
es del
also
2024,
shows the
son más
distribution
una
in
distribución
2024. This
más,
is
digamos, en zonas
um,
verdaderamente donde esperaríamos más
distribution
de zonas amazónicas.
in Amazon
Mientras, como
areas.
pueden ver también en
And as
este
you can see
2025
here
ya
in
vemos una agrupación de
2025,
casos
we
en el
already
suroeste
see
de Brasil,
here
en particular en el
a
sur de
set of
Brasil,
cases in the
en particular
southeast
la
of
zona
Brazil,
alrededor
especially
de
in the
Minas
south of
Gerais y
Brazil,
São Paulo,
around Minas
como
Gerais and
también,
Sao Paulo,
también en
and
parte de
also
Colombia, donde en
in
principio no
Colombia,
esperaríamos encontrar
where we were
fiebre
not
amarilla. No
expecting
entro en este
yellow
detalle porque
fever.
seguramente los colegas van a entrar más en esto. Nada más para recordarle que hay publicaciones de
I would
las
like to remind you
actualizaciones
that we have this
epidemiológicas. La última, de
publication
hecho,
on
fue
the
ayer. La pueden
epidemiological
encontrar. Hay
situations, the
todos los
epidemiological
detalles que
updates, and
puedan
here the
necesitar
last
también en
published
esta
was
de
yesterday,
hecho,
and
que
here
vamos a
you can
hablar de
have
esto.
all the details. And in fact, we
Quizá
are
que
going also to
quisiera
talk
tocar dos
about
puntos que son
this. I would like to
fundamentales un
mention
poco en esta
here two
transmisión. Una parte
things that are
seguramente el vector y la
essentials
otra
in
parte
this
seguramente
transmission.
son
On the one
aquello que
hand, we
son
have
el
the
papel,
vector, and on the
obviamente,
other
de los
hand,
primatas los
we
humanos.
have
Aquí ven
the
aquello que es una
virus
parte
that kills
importante, creo, de
humans.
que lo
And
que se ha
here
visto
we can see
también,
an
no
important
solo en
part.
términos de fiebre
Here
amarilla,
we
pero
were not
también de que lo que pueden
only
ser también,
addressing only
obviamente,
yellow
los otros
fever, but
arbovirus,
also
cuales por ejemplo el
the
dengue.
others
Ustedes ven
that are
aquí
related
lo que
to
es
dengue.
la evolución
And
de
here you
aquello
can
que
see
fue
the
un plan importante
evolution
de
of an
erradicación
important plan
a
of
partir de los años 30,
eradication
40,
since
de
the
aquello que fue
30s, the
la Aedes aegypti,
40s,
que casi
the for
logró
Aedes
a llegar,
aegypti
pero finalmente
that
cuando
was
se
almost
cortaron
achieved
los
by
fondos para este
finally
tipo de
when
iniciativa,
funds
Aedes
were
regresó
interrupted for
bastante
this
rápidamente en toda la
initiative.
región.
It
Ahora, en términos de
returned to
que
the whole
sabemos
region.
de Aedes aegypti, obviamente está presente hoy en día, tiene una posibilidad de vivir en varias regiones, en varios países, en varias latitudes también de nuestra región. La
In
otra parte
different
nueva
regions, in
seguramente es lo
different
que es
countries in our
el
region,
pseudofitos
we
que ha
can
sido
find
introducido
this
en épocas más
one.
recientes y que seguramente
Recently,
también es un tipo de vector
it's become a
bastante
type of
útil en el sentido
vector
que puede adaptarse
that can
bastante en
adapt
este
very
sentido.
easily.
Importante también
Something very
reconocer que
important is to
si no vemos
recognize
transmisión
that if we don't see any
urbana en el
transmission, any
senso
urban
estricto, no
transmission,
es porque los
this
Aedes
is
no
not
sean conductores eficientes en la transmisión. Aquí ven, por
because
ejemplo,
it does not
algunos
transmit
varios
the disease.
ejemplos de
You
que
can
lo
see
que ha
here
sido
many examples of what
un estudio
has
en el
been a study,
2017 en
a
Brasil, que en
2017
abajo a
study.
la derecha, aquí lo que
To
pueden
the
ver
right, you
básicamente
can
es si es
see
verdad que
at the
magogos
bottom
y sabetes son,
that
en particular,
these
sabetes son
imagogus
más,
and sabitis
pueden
are
transmitir con más
or
eficiencia
can
a que lo que es
transmit
el
more
virus de la fiebre
easily
amarilla, o por lo menos puede infectarse
the
más
yellow
con
fever.
eficiencia. Es también verdad que hay algunas
It is also true
combinaciones de
that there are
virus
some
y de
combinations
bacterias que también son extremadamente
of viruses that
capaces
are
de eso. Pero en
extremely
principio todos
able
los
to
virus,
transmit the disease.
todas las
But
especies de
all
vectores
these,
mostradas
all
aquí
the types of
pueden
vectors that we are
infectarse, y
showing you
también este estudio
can
muestra
transmit
también cómo
the
se
disease.
puede
And this
enfrentar
study
el virus
shows
también con
how
su
the
saliva en este sentido.
virus can
La
be
otra parte
transmitted.
de la ecuación es obviamente que lo que son los
So
primatas no humanos. Y
the
estos
primates,
primatas, diferentes especies que son
the
susceptibles de
different
diferentes maneras
types of
también
primates
a fiebre
are
amarilla, se
also
encuentran a lo
exposed to
largo
yellow
de
fever, and we can
todos los
find them
países, en
across
particular
all the
13 países
countries.
también que mencionaba,
Mainly these
que
13
deberíamos
countries
definir
we
más
talked about.
exóticos que
We need to,
endémicos.
there are
En esto obviamente
countries
es
that are
importante
endemic
también porque
also.
finalmente en la
Finally,
propagación de esta ola
in the
epizótica,
spread
que
of
llamamos
this
ola epizótica, no son necesariamente los monos
episodic
que se
wave,
mueven, son los
it's not
mosquitos que pasan
the primates that move actually, but the
de manada en
mosquitoes
manada
in groups.
primates en
They
unos
go
pases
from one
básicamente
group of
a lo
primates
largo
to
de
the
que lo
other
que son
one,
estos corredores ecológicos, o
all
también
across
en aquello
these
que pueden
ecological
ser
corridors.
parques urbanos, o
And we
también
find them
áreas
also in urban parks, in
muy
areas, in very
selváticas alrededor
wooded
de las
or
ciudades.
sylvatic
Eso
areas
seguramente donde cómo
near the
vemos esta
urban
transmisión.
centers.
Y
So
ustedes
this
ven
is a
también cómo eso
transmission
un
of the
poco se
virus.
relaciona a que lo que ha
And
sido
how
el
does this
desarrollo
link
urbanos
with
que han
how is
tenido
this linked to urban
varias ciudades
development
en
in
América
different
Latina.
countries
Es
in
el caso
South
de São
or in
Paulo
Latin
entre
America?
en
Sao Paulo
1986 el 2013, donde
from
no es
1986 to
necesariamente un
2013,
crecimiento concéntrico.
we are not
Más bien
seeing,
realmente como también
or what we
hay
are seeing here is
compenetración entre
a
lo que son áreas
penetration
más
in
naturales, más selváticas,
more natural sylvatic
que lo que era
areas.
antes. Básicamente yo lo imagino como un
I
pulmón con los
imagine this
alvéolos,
as a
donde se
lung
crea una posibilidad de
where
contacto
there is a
que es
possibility of
mucho más
contact
enorme de que lo
that
que es
is much
realmente
higher
de primera vista, que lo que podría ser
than
este
what
contacto
the
entre la
nude
interfaz,
eye can see,
de
this
la
contact
población
between
humana y que
the
lo que puede
human
ser
population
el medio ambiente.
interface and the
Y
environment.
este, por ejemplo, un caso que a mí siempre me
This is
gustó
a
mucho,
case
un
that I
caso
always like to
específico
show, a very
en San
specific
Paulo en
case
el
in Sao Paulo
2017-18.
in
Ustedes
2017,
ven básicamente el lado
2018. What you can see
izquierdo,
here to the
aquello donde
left
se encontró
is the
un primata que
area
finalmente
where we can find a
se demostró
primate that
ser también
was shown to
infectado.
be,
Y
that
ustedes
was
ven que
infected.
básicamente a
You can
este
see here
río
that
que entra
in this
realmente al
river
lado de que lo que es una zona densamente
that is
poblada.
near a
Justo arriba de que
very
donde está el mono, ve, por
a highly
ejemplo, una
populated
parada de taxis, ¿no?
area.
Donde están
There was a
también un
taxi
taxista y obviamente esto
station
obviamente
near
crea
this
también la
place.
posibilidad de
And of course,
un
there
contacto
was a
bastante estrecho
possibility of
entre
very
aquello
close
que es
contact,
los humanos y aquello que son vectores siempre selváticos,
a
no
contact between
necesariamente
humans and
noedes,
vectors.
con aquello que son también humanos susceptibles, no vacunados. Y
And we
esto
are talking about
obviamente
humans that were not
es importante
vaccinated.
también porque lo vamos a tener a ver
We
aquí lo que el papel también de que lo que puede
can
ser
see
la
here
vigilancia de
how
epizootia
important
en términos de
surveillance,
poder
exotopic
darnos
surveillance
una alerta
is,
temprana de que lo que
because
es
we
la
can receive
ocurrencia, la
an
posible
early
ocurrencia de fiebre
warning of
amarilla,
possible
pero también
occurrences of yellow
junto con
fever,
aquello que el modelaje de
and
estos
together with
corredores
modeling of these
ambientales,
corridors,
de poder predecir dónde
ecological
esto
corridors, we can
puede ir. Y
predict
también esto en
what that
particular en
trend
zonas
can be,
donde no se ha
mainly in
alcanzado a hacer grandes
areas
campañas de
where
vacunación,
we have
podría ser también
carried out
una
very
ayuda en
important
términos de
vaccination
definir
campaigns. This
exactamente
could
dónde
help
uno
us
podría
to
ir adelante
define
de
how
la ola epizótica con
the
vacunación
wave,
de
the
humanos.
episodic wave,
En
could
fin, esta un po'
go.
mis dos láminas de conclusión
These
es
are my
decir que
two final slides. I would
históricamente
like to say
a lo
that
que son los libros de
historically,
texto todavía
in the
vemos estos dos
textbooks,
grandes
we
ciclos que
see
están
these two big
descritos. Una parte,
cycles,
el ciclo
transmission
selvático,
cycles,
y
the
la otra parte, el
sylvatic
ciclo urbano.
cycle and the
Hemos visto que lo
urban
que puede
cycle.
ser
We've seen that
tradicionalmente esta dicotomía entre que lo que
this
son los
dichotomy
lugares de exposición y aquello
between
que
the
son realmente más los
exposure
lugares
places
de
and
selva
those
versus
places that
realmente
are more
zonas urbanas,
sylvatic,
aquello que son
wooded,
vectores
also
más
urban areas,
vectores
which the
selváticos
vectors we've
versus
seen were
vectores urbanos,
what
y
vectors
aquello
we
que también
have,
tiene es
human
realmente
vectors,
el
sylvatic vectors.
amplificador. Pero obviamente
We
esta
can see this
experiencia, sobre
amplifier
todo del
effect. The experience we
2016-2018,
had in
19 en
2016,
Brasil,
2018,
posiblemente que lo que
19
estamos viendo
has
nuevamente
shown
nos indica
us
también que a
that
esta en modalidad, este ciclo
this
intermedio, si quieren, no
intermediate
necesariamente
cycle,
intermedio,
if we can call it like that, not
hay
necessarily
que matizar
intermediate,
un
but
poco esta
we
distinción,
need
¿no? Del
to
libro de texto,
really
¿no? En el sentido que puede haber también esta
understand, comprehend
transmisión,
this
este
definition,
ciclo entre
because
comillas silvático,
this
porque es todavía
sylvatic
con
cycle
vectores, con los mismos vectores, con los
refers to the
mismos
same
amplificadores
vectors,
del ciclo
these
silvático
amplifier
propiamente
vectors
dicho,
that we
pero
have in the
ocurre en aquello
sylvatic
que son
cycle.
realmente más
But
los
now we're
bordes de grandes ciudades
talking
metropolitanas
about
mismo, o
the
también en localidades pequeñas
outskirts,
rurales,
the
donde
environments
obviamente
of big
también una
cities, and also
compenetración
rural
muy
areas
importante con aquello que
with
es el ambiente a su alrededor.
where there is a very
Finalmente, nada
important
más para
contact with the
destacar que
surroundings. I would
seguramente
like
la
to highlight
vacunación
also
sigue
that
siendo
vaccination
una parte
remains
central de que lo que
a
tenemos que
key
hacer en
factor,
términos de prevenir
a key
y
mission
también
for us to
responder de alguna
prevent,
forma a
to
fiebre amarilla.
respond,
Pero
also
seguramente
to give an
reconocemos que hay
proper
muchos otros
response. We
componentes
acknowledge
en
that there are
aquello que
many
la
other
preparación como también a la
components,
respuesta a la fiebre amarilla
such as preparedness, yellow fever response. We are talking about planning, about coordination, laboratory capacity, different factors. What I was talking about, episodic episodic surveillance, modeling for early warnings, epidemiological surveillance. Unfortunately, the only warning we receive comes very late, frequently. There are many aspects to the epidemiological response. We have entomological surveillance, vector control, which is extremely important, exposure prevention, in health institutions, immunizations, as I said, with different types of immunization. In this specific case, with this vaccine, we are talking about the reduction, a very important reduction regarding transmission, and clinical management, finally, which sometimes or very frequently is the only opportunity we have to save lives, to reduce lethality. In the case of yellow fever, we can reach up to 50-60%, but if we have a proper clinical management, we can reduce this percentage. And this is so a very important aspect. I would like you to understand that the great difference in this dichotomy between what the urban isovatic cycles is becoming less and less significant. I would like you to understand how important yellow fever response is, and that it has a lot of components that we're going to address today. Thank you very much, Jairo. I give you the floor. Thank you very much, Andrea, for this introduction. I think that indeed what you have said is a very important conclusion that we're going to be seeing, how we eliminate these borders between the sylvatic cycle, urban cycle. We need to understand very well these different scenarios, all the factors, the vectors, because this is what is going to help us reduce the spread of the virus. And as we have said, we need to stop this increase in the risk of transmission at a urban level or peri-urban level, because the impact would be very significant. You said also at the end that all the components of a response is what we are going to address today, and also we're going to see the current situation in two countries. We didn't have much time to invite other countries, but currently we are focusing on the response in these two countries. As you said, Andrea, yesterday was published a new epidemiological warning. You're going to find the link to this warning in the chat box. You will have here more information about the current situation in the region. But to give you in a few words, overview of what is happening, we invited two colleagues from the Ministries of Health, and I want to welcome Dr. Mauricio Vera, who is the coordinator of the Integrated Management Group of Endemic Diseases of the Ministry of Health of the Republic of Colombia. I had the pleasure of working with you, Mauricio, on yellow fever 20 years ago in Colombia. So we have many stories to tell about this work. You have the floor.
Jairo, muy buenos días.
Jairo,
Muchas
good
gracias por la
morning. Thank
convocatoria de
you
este
very
escenario,
much
este
for
webinar. Un cordial
inviting me
saludo
to this
extensivo
webinar.
señor ministro y señor viceministro.
Minister and Vice Minister of Health,
y a los demás asistentes.
say hello as well.
Rápidamente voy a
Very
compartir
quickly, I'm
pantalla.
going to share my screen.
Me indican, por favor,
Please do tell me if you can
si
see
ya
my
la
screen
están observando en formato de presentación.
on the presentation mode.
Por alguna razón no logramos verla en
For
presentación.
some
Yo creo
reason, we
que no
cannot
cambia
see the presentation mode.
Pero tal vez si quieres agrandar la imagen
Maybe you can zoom in
no hay ningún problema.
the image.
Ok, entonces voy a tratar de hacerlo de otra forma.
Okay, let me try something else.
Compartir pantalla. Pantalla completa. No entiendo. Ok.
Luego si puedes ir pasando slide por slide.
Okay, you can
Gracias.
go to the next
Ok,
slide.
entonces básicamente voy a presentar rápidamente
I'm
la
going to
situación de fiebre amarilla en
present the
Colombia año
current
2024
situation for
2025.
yellow fever in Colombia
Simplemente retomo las
2024-2025.
palabras generadas tanto por el doctor Aldigeri como el doctor Vicari. Realmente
As
Colombia
Dr. Alighieri and Beccari
es
said,
un país con
Colombia
ciclos
is a
enzooticos
country
muy
with
marcados.
exotic
Estos ciclos enzooticos
cycles,
han
very
generado
important ones,
brotes inicialmente
that
cada
have
5 años,
generated
luego cada 10 años,
outbreaks
posteriormente cada
every
20 años.
5 years,
Esto se
every
puede
10,
deber
every 20
básicamente
years. This is something
al
that we can
mejoramiento de las coberturas de
see
vacunación, pero también que la
regarding
población
when
cada
we
vez es
see
más urbana y menos rural.
how the
Sin embargo,
vaccination
pensemos que lo que
campaigns
ocurrió un
have
poco en la historia del virus que están
increased.
presentando estos brotes, y estos
So
brotes
why
están
are
asociados
these outbreaks
directamente
appearing? These
con
are
los
linked
desplazamientos
directly
poblacionales por
to
algunas actividades económicas que ingresan
population
a algunas
movements,
zonas donde está el
some
ciclo
economic
enzootic establecido.
activities.
Estas actividades económicas, pues
These
inicialmente era
economic
caucho, posteriormente
activities
fue petróleo minería, posteriormente fue coca amapola y
are
actualmente es
the
café
oil
lo que está
activities,
relacionado.
coke
El
activities,
último gran
coffee
brote que tuvo
activities. The
Colombia debido
last
a esto, que
big
fue el del año
outbreak in
2003-2004 en la Sierra
Colombia
Nevada de Santa Marta, con
was in
una
Santa
extensión hacia
Marta,
Putumayo y Caquetá en el
in
año
Putumayo, mainly in
2005-2006. Y
Caquetá
actualmente se nos reactiva
in
el ciclo
20
epidémico
in
desde el año
2006, and
pasado
we
para
are
esta
having
misma
another
época,
epidemic
presentándose
cycle
casos
since
tanto en el
last
sur y
year. We
desplazándose el
have
virus
cases in the
lentamente
south,
por la cordillera oriental.
in the eastern
Colombia, entonces con la información que
mountain
teníamos,
chain
habíamos establecido
also.
un plan nacional
So
de
we
fiebre
had
amarilla,
established a national plan for yellow
identificando
fever
cuáles
in
eran nuestras áreas
Colombia.
de
We
riesgo, que son
identified
las que están
which were
coloreadas de
the
verde,
at-risk
y
areas
observen
in
ustedes muy
green,
bien
you can
que
see them,
corresponde
and look
muy bien con las
carefully.
partes amazónicas
This
de los
corresponds
llanos
to
orientales
the
del
Amazon
Catatumbo y la costa
areas
atlántica. Sin
in the
embargo,
Atlantic
nosotros lo que
coast.
estamos observando es que
However,
cuando se nos
what
presentan
we
los
are
casos
seeing
en
is that when
Amazonía
we
y
have
llanos orientales,
these
realmente
cases
son
in the
casos aislados. El
Amazon,
potencial
we also have
epidémico lo tenemos
isolated
sobre la
cases
cordillera
in
oriental, básicamente
the
sobre la vertiente oriental de la cordillera oriental,
eastern
es donde tenemos ese
mountain
potencial.
chain.
Y actualmente lo que estamos
And
observando es
currently,
que el virus logró
the
pasar la cordillera
virus
oriental y actualmente está en la
has
vertiente
gone
occidental de la cordillera
beyond
oriental,
this
con
mountain
casos
chain.
el año pasado en junio
We
en
had
el
a case
departamento del
in
Huila,
June last
y
year,
posteriormente el
and
gran brote que tenemos
we
en el
also have a
departamento
big
del Tolima.
outbreak
Ustedes
in
observan un pequeño
Colima, in
punto
the department of
hacia
Colima.
la estribación de la cordillera central. Es un caso
So we
que
have
fue
also
confirmado
a
el día de
case
ayer,
in
que
the
se encuentra
central
actualmente
mountain
en
chain.
investigación,
This
pero
was
que nos genera una nueva
confirmed,
alerta
it's
porque
under
nos está
research,
indicando de que el
but
virus
this generates
está
a new
pasando de
warning.
la
The virus
cordillera
is
oriental
going
hacia la
from
cordillera
this
central con un contexto
mountain
epidémico de
chain
desplazamiento poblacional
to the in the
bastante
eastern part to the
diferente.
central part.
Aquí también vale la
So
pena,
this is something
comparando un poco el mapa que
different.
presentó el doctor
It is
Aldighieri
important to note
de
here,
riesgo
if
para las
we
Américas,
compare this to the
precisamente esta zona no era
map
considerada
that
a
Dr.
riesgo, el
Alguerelli
Valle
showed,
Alto del río
this
Magdalena.
area was not considered
Y aquí estamos
a
observando transmisión en esta
at-risk
zona. Entonces
area,
estamos
but
considerando
we
que estos son
actually are
focos
seeing some cases now
emergentes
here.
actualmente.
So these are emerging cases.
Simplemente esta diapositiva,
This slide
quiero llamar la atención
shows,
de que, bueno, yo tomé una fuente formal que es el CITRE. El último
I'm using
CITRE
a formal
es del 21 de
source,
marzo
which
y
is
hasta esta
CITREP.
fecha se han confirmado 54 casos, pero realmente en este
Since
momento tenemos
March, we had
confirmados 56, todos son del área rural,
54
el
confirmed cases,
78% del departamento del
60
Tolima,
from the rural
hombres en su gran
area,
mayoría,
in the
el
Tolima department as
95%
well,
no tienen
mainly
antecedente vacunal y una
men,
letalidad del 48.1.
and a
Esta
lethality of
letalidad
48.1%. This was different from 2024, 2025, in which this lethality was reduced because we were talking about almost 60%. But the overall lethality is 48% for 2024, 2025. I would like to talk about the age, this variable. Look how people older than 59 present most of the cases. And this was a challenge for us. You could ask yourself, why? We have areas that are at-risk areas, but here we have a vaccination cohort that goes beyond 60 years old. We didn't have much experience regarding vaccination for these ages. So Colombia has applied a response with a formal communication. And here we have 5 strategic lines, 5 big strategic lines. Integral management, health management, every line has a specific objective. Regarding vaccination, we can see here the Colombia map. We updated which were our coverage at every municipality. And what you can see here is that in the Amazon area, we have a coverage of over 80%. But in the Pacific coast, in the center, the coverage doesn't reach 20% in the rural areas. So we have, this is really important when we talk about these rural areas in which we have many cases. However, for the Tolima department, in the outbreaks, we have applied 61,000 doses. How can we reach this? Thanks to our primary health services that have allowed us to enter these rural areas. In the municipalities that have an active outbreak, we have applied 25,000 doses. And also in different municipalities that are at risk, but where there is a barrier that has been generated. So regarding the age group, Colombia made the decision of vaccinating the population over 60 years old. And so far we have vaccinated more than 3,000 people over 60 years old, and we have learned a follow-up strategy regarding this group. So far, there has not been any adverse effect or negative effects in these age groups. To end up, we have tried to generate some tools. We have 3 tools that you can see here. Colombia last year worked on some guidelines for the clinical care of yellow fever. And because the comorbidities, all the different factors, with all the issues that we had to overcome, we were able to work on this tool. There's a department near Bogota where there were more than 2 million people. When there are festivities or holidays, this department receives more than have a population of more than 2 million people. So we are integrating here the integrated clinical management, and this is a publication about that. And something very important, we have done a very important research work on health services, and we saw that we needed to work more on some health institutions. or
Y aquí hay muchas
centers.
preguntas,
How to
como por
work
ejemplo, las
regarding
áreas
integrated
hospitalarias se
clinical
tienen que
management.
valorar igual los
The
riesgos.
hospital, for
Las
example, we needed to
intervenciones
ask
tienen que ser
ourselves
iguales,
is
cómo se
in
trabaja en el
hospitals
entorno,
we needed
y
to
pues al ver todas
approach
estas
the
preguntas,
issue the
nosotros estamos
same
generando
way.
este instrumento, los tres deben
So
estar
thanks to
publicados
all
en
these
próximas semanas.
questions, we are
Ya para
generating these
finalizar, voy
three
a tomar
tools.
unas palabras que mencionaron ahorita.
And
La
regarding my
primera
final
es que pues, la
remarks,
historia se repite, en Colombia se
well,
está
the
repitiendo, la
history
NADI,
tends to
Instituto
repeat
Electoral Antiterror,
itself.
así mismo lo
Indeed,
presenté para Colombia con los datos de
the
Colombia,
same
se
in
está repitiendo la
Colombia.
historia.
Colombia is repeating
Pero
its
también me gustaría
history with all the
mencionar
data we have
que
collected.
cuando
But
nosotros
I would
hablamos de,
like to say
siempre
also
hablamos de
that
la fiebre amarilla
when we
selvática,
talk
pero
about the
aquí nosotros observamos
cycles,
una
we talk
fotografía
about sylvatic
y realmente lo que nosotros
or
observamos
jungle
son
yellow
bosques
fever.
a los cuales están ingresando las
We have
personas que los están salvando,
rainforests
no necesariamente son
where
selva,
there's a lot
donde
of
está cultivando
people and
café,
some
donde está
people
cultivando
that
cacao, donde
unfortunately are
estamos
carrying
teniendo
out
ganadería y
deforestation
nos están creando unos
activities.
mosaicos ecológicos y allí
So
es donde realmente está presentando
we
la
have
situación. Cuando
ecological
nosotros revisamos los casos,
gaps
siempre se está diciendo que es el bosque de
in this
Galilea, pero ninguno se fue
area.
al interior del bosque. Todos son en la periferia del bosque donde se ha hecho la alteración
We have
ecológica.
cases in the
Obviamente, pues
surroundings of
los
the
equipos
forest, but
básicos
what
son los
about
que nos
in the
están
center
ayudando
of the
para poder
forest?
entrar a trabajar, o si no, realmente no hemos
So
podido
the
avanzar y pues aquí
sylvatic
sería más
groups are
complicado.
helping
Se nos están
us
presentando
work in
barreras
this
a la derecha
area. There
vacunación
are some
básicamente por motivos
obstacles
de credos religiosos, pero también
because of
seguimos con los
religious,
problemas de los antivacunas posterior a COVID.
because of different
Algo muy
religious
importante que hemos venido
reasons,
aprendiendo es la vacunación en población
or
adulta
because there
mayor
are
en estas zonas
populations that
rurales
are
y donde se
against the
registra una
COVID
cuenta.
vaccine.
Colombia, alrededor del
In rural
14% de la
areas and
población está
emergency
adulta mayor,
scenarios,
pero realmente
vaccination
cuando
for
revisamos los
older
datos,
people is
un poco
key.
más de cada municipio, lo que estamos observando es que las personas que están dentro de la zona rural son los adultos mayores, los jóvenes están en las zonas urbanas. Tenemos un problema
The
muy
people that
complicado
are
de
in these rural
costiculación y
areas are
obviamente
the
aquí
older
la
people.
adecuación clínica y la organización de los
Younger
servicios
people
tal con
are
las
in the
circunstancias que tenemos,
urban areas,
también
and
nuevo
this is very
lineamiento,
important also
tenemos
to
que trabajar muy
notice.
fuerte para
So we
evitar
need to
la
work
urbanización. Tenemos el
to
vector en todos estos municipios,
identify
todos estos municipios en las áreas
how
urbanas donde tenemos
urbanization
que
works
para
in
dengue,
this
pero aquí
area.
también nosotros entendimos cómo es que tenemos que ir
We
abordando los
have done
establecimientos sanitarios de entorno.
this for
Y el
dengue,
gran
but we
reto
need
que
to do
tiene la
this
vigilancia
also for yellow
epidemiológica y el
fever.
reservorio. Esta es la vigilancia
We
preventiva que
also
nos
have
tiene que
here
orientar la ruta
the
del para
virological
dónde vamos. Nosotros
surveillance
tenemos
and
que tratar
reservoir
de estar adelante del virus y no
surveillance, which
siempre
is
detrás
a
del virus.
great challenge. We need
Simplemente
to
ya
be
para
one
terminar,
step ahead of
agradecer
the
el
virus
trabajo que
and not
venimos
behind.
realizando, agradecer a la
So
Organización
just to
Panamericana de la Salud,
finish,
todo el acompañamiento que nos ha venido realizando, los aportes,
we have
desde el día
done
uno
such a
realmente han
great
estado trabajando con
job
nosotros de la
from the
mano,
very
pero también yo
beginning
quiero
regarding
agradecer a mis
this
compañeros del
issue. I would
Ministerio
like
de
to
Salud
say
que han
thank
estado
you really
en el
to all
frente de
my
trabajo,
colleagues,
a los hospitales, todo su talento
thank
humano, al
to the
perito Lleras Acosta, que
hospitals,
es un centro de
all
referencia
the
transmitido,
human
teniendo una
resources of great
gran
talent.
capacidad para el manejo de los casos,
They all have
especial
great
a las personas de
capacity
las
to
personas del
handle
Tolima,
all
el PIB y
these
del Instituto Nacional de
cases
Salud.
in Tolima,
Muchas
in the
gracias por
National
este
Institute of
espacio
Health.
y
Thank
estoy
you very much for
pendiente
this
de
space.
las inquietudes que tengan.
And if you have any questions, please
Muchísimas
feel free.
gracias, Mauricio, por
Thank you very
esa
much,
explicación de la
Mauricio, for
situación que
this
está viviendo
for
Colombia
this
y lo que está
overview
sucediendo
of the
actualmente en
situation, of
Colombia.
the current situation
Definitivamente
of yellow
tienes toda la
fever
razón.
in Colombia.
Creo que más
And you're
allá de saber
right.
y
I
ver
think
cómo
that
la historia se está repitiendo,
it is not
tenemos
only important to know
ahora
how history is repeating
un
itself.
escenario donde
We
se puede complicar
now have
mucho.
a
Se
scenario that can
aproxima una época de
complicate things.
vacaciones,
We are about
de Semana Santa.
to
Este
we are very
momento
close to
actual es una
Easter. We
zona
are
que es muy
having these
turística,
holidays, and this is a
donde
very
tenemos que estar muy
touristic
bien
area.
preparados
So we have
y
to
tratar de
really be prepared.
identificar de manera
We need
temprana
to
todos los riesgos
identify
que
in
podamos
an
tener. Así es
early
que
manner all the
completamente
possible
pertinente y
vectors
muchísimas
cases,
gracias.
which are
Yo les
the
voy a pedir que, por
relevant
favor, a
actions
los
to be
participantes
adopted. I will
que sus preguntas
please
las
kindly
pongan en la
ask the
casilla de
participants to share
Q&A,
your
de
questions in
QIA.
the
Ustedes leen
Q&A
abajo porque es más fácil
box
tener acceso
so
ahí a
that
las
way
preguntas y
we
poderlas
can read
responder.
your
Les voy a pedir
questions
también a
more
los
easily. I'm going to
panelistas que por
ask
favor vayan mirando
our
pues las
participants, our
preguntas y
panelists also,
respuestas porque ya hay muchas
to
que tal vez pueden ir respondiendo
start
para
maybe
ganar
looking
tiempo.
in the chat,
Y
in
Mauricio
the
en particular,
Q&A
hubo
box to see if there's
muchas
any
solicitudes,
questions.
mucha información que tenías en la
There were
presentación. Entonces, si eventualmente también la puedes presentar y lo mismo para todos los
maybe you can share your
panelistas, sí, no hay
presentation,
problema para después poder
Mauricio.
poner a disposición estas
Of course,
presentaciones
we're going to
para que
share
la
the
gente las pueda
presentations
tener
with
y
you
pueda ampliar y
afterwards
tomar un poco más de
so that
información
you
y,
can
por supuesto, muchas
see all the
inquietudes. Y ahora
information
para ver el resumen de la
more
situación
closely.
actual
Now we're going
de
to
fiebre
have
amarilla en Brasil,
an overview
tenemos al
of
doctor
the
Daniel
yellow
Ramos.
fever
Él es el
in
coordinador general
Brazil.
sustituto de
with Dr. Ramos, who is the coordinator of the Secretariat of Health Surveillance of the Ministry of Health in Brazil. We've had the opportunity of working together in Brazil, and he's one of the biggest experts on yellow fever in Brazil. Dr. Ramos, you have the floor.
Obrigado, Jairo. Obrigado a OPAS pelo
Thank you, Jairo. Thank
pelo
you,
convite.
Pejo, for the opportunity and for the
Uma correção, eu
invitation.
sou o coordenador
I'd
geral
just like to
substituto,
make a
a doutora
small
Lívia Vinhal
observation.
é a
I
coordenadora
am the
titular, não pôde estar
acting
aqui por uma agenda
coordinator.
importante,
Our
de
coordinator, Dr.
pactuação
Lydia,
tripartite aqui no
unfortunately was
Brasil.
not able to
Eu vou
attend this
compartilhar minha
meeting.
tela e tentar
So I will be sharing my
ficar
screen
dentro do tempo, já que são muitas
to make
coisas para
sure
falar a
that
respeito do que a
I
gente
don't
está
go over
assistindo
time
aqui no
because we have
Brasil
many
nesse
things to
momento.
discuss.
Eu vou seguir, se
And I
tiver algum
wanted to
problema,
speak
me
about
avise,
what
por favor.
is going on in Brazil right now. I'd just like to let our participants know that Dr. Daniel will be speaking in Portuguese. However, as you know, we have simultaneous translation. So if you feel you need to change the language as you wish to the language you feel more comfortable in. Thank you.
Nós temos vivido
Well,
no Brasil surto de febre
in
amarela,
Brazil,
tanto
we
na região
have an
amazônica quanto fora
ongoing
da região
outbreak of
amazônica.
yellow
O
fever, both in
comportamento
the
do vírus
Amazon
tem
region
sido
and
detectado
otherwhere.
sistematicamente a
The
ocorrência
virus has been
de mortes e primatas por
systematically
febre amarela
detected,
logo depois do
and
inverno.
we have
Então,
systematically
passado o mês de
detected
julho, a
also
partir de
the deaths
agosto, a
of
gente começa a
primates.
detectar
From
febre amarela
July
acontecendo
to
nos
August, we
primatas, e
start
isso
to
também
detect yellow fever
sistematicamente tem
in
sido
primates, and
prenúncio de que a gente vai
systematically,
assistir
this has
transmissão
been a
entre
harbinger
humanos
of
durante o período
transmission
sazonal. Para nós
among
do Brasil, isso
humans
se
in
estende de
the
dezembro
season. In
a maio do
Brazil,
ano
the season
seguinte.
is from
Então, vejam que os
December
casos
to
humanos
May
estão
of the
concentrados dentro desse
following
período
year.
sazonal.
Most
Hoje no
cases
Brasil
are
nós temos
clustered
66
within this
primatas não humanos
season.
confirmados para febre
Today
amarela,
in Brazil, we have
84
66
casos humanos com
non-human
32
primates
óbitos e letalidade
confirmed,
de 38%.
84
Algo
human
interessante que é
cases
possível observar quando tem um número
with a
aumentado de casos, e
mortality
nós
of
observamos isso
3%.
também nos
It's
últimos
an
anos,
interesting
é uma
thing to
correlação
see
positiva
with
entre
an
idade e
increased number of
letalidade,
cases is
de
the
modo que, assim
positive
como o colega da
correlation
Colômbia
between
apresentou,
age
o Brasil
and
tomou a decisão
mortality.
de
As
incluir
our
maiores de
colleague from
60 anos
Colombia
na
said,
rotina do
Brazil
programa de
decided to
imunização
include
aqui no
people
país.
over
Embora isso não esteja
16
ainda
in the
documentado, é algo que está
routine vaccination
verbalizado e
program
apresentado
in
como
Brazil. It's not
recomendação
yet
nas
documented,
falas
but it has
desde
been
então.
presented as a
Na distribuição, nós temos
recommendation
ocorrências
in
tanto na região
authorities,
norte, que é considerada a região endêmica,
from
quanto na
authorities
região
since then.
sudeste,
We
e
have
aí da região extra-amazônica do país. Geralmente os maiores
cases in the
impactos
north
estão
region,
justamente
which is the
nessas
endemic
regiões.
region, and in
A
the
título
southeast
de
region.
comparação, nós temos uma vigilância
Normally,
de
the
primatas que
highest
é
impact
muito
of the
incipiente no
disease
norte
is
do
clustered
país.
in these
Então, nenhum
regions.
primata
For
confirmado. São 40
comparison's
casos, mais
sakes,
um
we
com
have a
ainda em
vigilance for
investigação. Desses
primates
todos, 6 óbitos
is
e
in its starting
15% de
stages in
letalidade.
the north of
Nas
Brazil.
ocorrências em São Paulo
To
e Minas
date, we have
Gerais,
40
são
cases that have
63
been
primatas
confirmed,
confirmados,
one with an
37 casos,
IPE,
mais
and
5 que
15
tem o
lethalities.
local
In São
provável de
Paulo and
infecção em
Minas Gerais, we have
investigação,
63
23
primate
óbitos
cases
e
confirmed,
letalidade de 62%.
37 cases, and
Essas
5
áreas
with a
são classificadas
probable
dentro
infection
do que
site
preconiza o
at
Plano de
that place, with
Contingência Nacional para as
23
Emergências de
deaths
Febre
and
Amarela,
a
segundo
mortality of
uma
66%. These
classificação de
areas
risco
are
que impõe algumas
found
ações a
within
serem
the national
realizadas a
contingency
depender do
plans
cenário.
for
No
yellow fever
cenário 3, o
emergencies,
que o Dr. André
according to a
Vicari comentava,
classification
e
of
nós temos
risk,
chamado de áreas urbanas com
there
influência
are certain
silvestre,
actions
são
that need to
transmissões que
be
acontecem
uh,
muito próximas de grandes centros urbanos
stated.
e que de fato
These
apresentam risco de
areas are
reutanização.
clustered
Embora nós
in
não
large
saibamos medir o
woodlands
tamanho desse risco,
near
aqui
large
estão
urban
embutidas algumas
centers.
ações que
And even
miram
though we cannot
monitorar
yet
essa situação
measure
e
the
gerar um
risk, here
protagonismo do
are some
serviço de
actions that
vigilância
try
e
to
identificar alguma
track the
modificação da
situations
transmissão.
and create a
Outra questão é sobre
protagonism
o perfil
for the
epidemiológico dos
vigilance
casos,
services.
também
Another
semelhante
issue
ao que o
on the
colega da Colômbia
epidemiological profile
mostrou.
of our
Esse é um
cases,
perfil
it
típico
is
dos
similar to the
casos de
colleagues
transmissão silvestre
of
do
what was
vírus.
mentioned by the
Então,
colleagues of
mais de
Colombia.
80%
This is
dos
a
casos
typical
indivíduos do sexo
case
masculino,
of
nessa faixa etária
of
que vai de 20 a 59 anos,
a
mas a gente pode observar uma
for people
diferença entre
between
aquilo que está sendo
20 to
observado no Sudeste
59. These
e na
cases
região
have to
norte
do
endêmica
with
do país.
transmission
Na
through
região norte, a gente
jungles,
tem um
and
perfil
this
de
has been
indivíduos muito
observed
mais
in the
jovens sendo
southeast.
acometidos,
However, in the
reflexo
north
de
part of the
problemas
country,
de
the
acesso
profile
à
of
vacina e a
individuals is
outros
much
serviços de
younger.
saúde, enquanto
This has
nessa
to do
região,
with
por conta de
problems
ser uma
with
área em que a
access to
recomendação de
vaccine and
vacinação
other
se deu mais
healthcare
tardiamente,
services.
a gente tem
In
menor
this region,
acumulado de doses aplicadas ao
the
longo do tempo,
vaccination
e isso reflete
recommendation
também numa
was a
cobertura
bit late,
vacinal menor.
so there
Em
has been
relação
a
às
certain
investigações de surto, destaque para a investigação
excessive
no estado
cases.
do
In
Pará,
terms
o
of
Ministério da
outbreak
Saúde, junto com o Estado, o município,
investigations in the
esteve
state of
em
Pará and the
Breves, que é
Ministry of
o
Health
município
and
que
the
está
states
detectando os 40 casos
visited the
até então,
municipality of
traçou um
Brevis, who
plano
has
de
a
investigação que
documented
envolve
history
vários eixos de
of
ação. Não
40
vou entrar
cases
no
till
detalhe,
now,
mas isso pode ser
and
visto
they
depois.
developed a plan with
Foram
several
49 técnicos
axes of
participando em campo, dos níveis
activity,
municipal, estadual e
49
federal, assim como o
technicians out in the
suporte que a
field,
Organização Pan-Americana da
representing the
Saúde, a Marinha do
municipal,
Brasil
state, and
também
federal
deram para
levels,
essa investigação,
including the
nos eixos de
support
vigilância,
from the
imunização, assistência, laboratório, entomologia
PAHO,
e
Brazilian
comunicação.
Navy,
Nessas ações, nós
and these
pudemos
axes of
aumentar as
vigilance
coberturas
are
vacinais nas
immunization,
localidades com
support,
ocorrência
lab,
dos
entomology, and
casos. Nós
communication.
também
For these
atuamos
actions,
no
we
deslocamento
were
dos
able to
pacientes, já
increase
que por
vaccinal
barco o hospital de
coverage
referência
for
fica
these
a 12
places,
horas
and we
de
also
viagem
work.
e a lancha
In
consegue
fact, the
fazer em
places these
3 a
people
4
live
horas.
are
Nós fizemos investigação
12
entomológica na área,
hours
inclusive em
away,
copa
and
nas copas
by
das
boat we
árvores,
were able. A
controle do
fast boat
Aedes
was able to
aegypti,
cut that down to
sobretudo
3 to
pensando no
4
risco de
hours. We also did
reuberização e
entomological
educação em saúde,
investigation in
tanto
the
para
area, especially
crianças nas
in the
escolas
tops of
quanto para a
trees,
população,
and
para a
we also
notificação
did
dos
uh,
primatas mortos.
work with
O que nós
schools,
vimos na
with
região foi a
children,
concentração
and
dos
also for
casos nessas
notification of
3
dead primates.
localidades
What we
do
saw
município
in
de
that
Breves, mesmo os
locality
casos
was
que
a
eram identificados um pouco mais
concentration
distantes tinham
in
relato de
3
viagem para essas
specific
áreas.
sites.
Ali
Even
tinha
the
também um problema de
cases
recusa da
had
vacinação, muito por
a history of
desinformação, e esse foi um
travel to
trabalho
these
em que as
places,
equipes
and also a problem
tiveram
of
que
refusal of
abordar e convencer as
vaccination
pessoas a
because
se
of
vacinarem. Nessa área já
disinformation.
foram aplicadas
And
18
the
mil doses de
teams
vacina
had
até
to
então.
speak to the people and
Também
try to work
a nossa
with
equipe
them
esteve em
so they
campo e
could
andando pela localidade, pôde
accept being
identificar
vaccinated.
várias
So
ossadas de
we
primatas nessas
applied
regiões. Todos os moradores
18,000 doses
relatam
of
que
vaccine,
morreram
and by
primatas desde
field work,
outubro
we
de
saw several
2024, mas
uh,
essas mortes não
uh,
foram notificadas. Então não
bones
há
of
eventos
primates
em
from,
investigação
but
nesses
these
animais,
deaths were not
embora o relato da
notified, so there
população
is
de que
no
todos os animais
investigation
tenham
for these
morrido, o que
animals.
gera
However, the
algo típico da
populace
febre
has
amarela, que é o
said that
silêncio nas matas. Também nós
that
já
these
sequenciamos
animals were dead,
pelo
which
menos 13
creates an event
amostras
which is typical
dessa
of yellow
região,
fevers, which is
todas
silent
de casos
jungles.
humanos,
We
e essas
sequenced
amostras se alinham
13
ao que tem sido
samples from the
detectado,
region, all of
pelo
them
menos
from
em Minas
human
Gerais, é o
cases,
mesmo vírus,
and at least in
embora
Minas
tenha
Gerais,
aberto um
we have
novo
found them
clado, e a
to
expectativa é
be
que
the
essa
same
circulação agora
viruses, and
no
however,
Pará,
it's a
nos
new
próximos anos, esteja
clavus.
circulando
And
fora
the
da região amazônica
expectation that
aqui no
in
Brasil,
that
e é importante ter essas sequências para a
we
gente poder
believe
monitorar
that this
isso
virus will be
mais à frente.
circulating
Sobre
outside the
preparação,
Amazon
nós
in
temos
Brazil.
trabalhado a
In terms of
modelagem de dados como um
preparation, we've
elemento
worked with data modeling
para nos
as an
planejar para a
element
ocorrência.
for
Esse é um
planning
grupo formado
ahead
por
for the
profissionais do
outbreaks.
Ministério,
This is a
conduzido pelo
group
Ministério
which
da
is made
Saúde
up,
e formado
which
também por
is
profissionais das
under the
secretarias
aegis
estaduais
of
de
the
saúde, de instituições
healthcare of the
acadêmicas como
health
a Fiocruz,
ministry,
a
with
USP de São Paulo, o
several
Instituto Pasteur
participants
também de
from
São Paulo, tem produzido
academia,
uma
from
série de análises que
Fiocruz,
tem
USP
dado
University
luz
from São Paulo,
sobre os
Instituto
rumos da
Pasteur from
transmissão
São
e
Paulo,
também
and
para as
this
recomendações
working
aos
group has
estados e
produced a series
municípios.
of analysis
Um exemplo disso foi em
and drafted
2019 e
recommendations
20, em
for
que
states and municipalities.
o
An
traçado dos
example is
corredores ecológicos, né, ou das rotas
2019
prováveis de dispersão do
2020,
vírus,
which is
proveu a possibilidade de
understanding the
antecipar a
probable
resposta e evitar
dispersal
que casos
rates
humanos
and
acontecessem.
ecological
Numa extensa
corridors
área em que o
for
vírus
the
esteve
virus
circulando entre primatas,
propagation in
isso
a
agora
large
está sendo
area
feito
where the
também para o
virus was
estado de São
circulating
Paulo,
amongst
prevendo
primates.
quais
This is
rotas
also
são prováveis
ongoing
para a
for the
dispersão.
state of São
Essas
Paulo,
rotas
and
são
the
as mesmas que
idea here
aconteceram
is to
em
understand how
2019,
the virus
2018,
propagates.
19,
These are the
né? E
same
aqui
routes that were
sobrepondo em
followed for
azul
2019,
justamente os municípios que
2020.
foram confirmados
So what we see in blue on screen is the municipalities with confirmed cases from 2014 to 2019. And by doing this, we can estimate distance based on the maximum speed of virus dispersion during the monitoring from 2020 till 2025, and the maximum length or distance of dispersion if the virus gathers speed. Now, we have also superimposed these layers to have an understanding of the in-depth understanding of the impact of yellow fever on human populations. And so by superimposing these maps, it gives us an idea of which aspects it gives a certain disadvantage to a given territory, and then we can work more assertively from that on. And so this has created a series of bulletins and communications and recommendations, and we also create a series of maps which are very objective to really try to give a series of possible way forwards for these municipalities. We also have, in terms of recommendations, we have informative recommendations that update in the scenarios and the modeling work. And this other one focuses on travelers, especially during Carnival. And the last published recommendations focuses on vector control for Aedes aegypti and Aedes albopictus in urban and peri-urban areas, which are areas that are considered of influence and are a reason of concern for Brazil and Americas. And the next recommendation that we're going to be publishing will bring this map and the recommendations that have to do with the map. And lastly, the documents that gives the ways forward and the protocol for Brazil regarding yellow fever, and we have worked on them to try to increase the contributions that we can make based on knowledge and all of the learning, all of the lessons we learned from this situation. I'm absolutely available for any observation. Thank you, Jairo.
Y como siempre, algo que yo debo decir que sucede con Brasil.
And as usual, what happens with Brazil is that we do learn a lot. Recently, we have learned a lot about your works on surveillance that are in-depth studies with your huge experience. And we try to replicate this experience in the other countries because it is definitely a huge experience. We are learning a lot. And in recent years, and we can see this in the last presentation and also in Vicari's presentation, they all coincide in the fact that all factors change all the time. The different components are being adjusted, are changing, and the response in the surveillance and in the response should also be adapted because we need to adapt our conditions. And we see that in recent months and in the changes that we are experiencing, we are now adjusting the guidelines for the surveillance of yellow fever at regional level. And this is a work that we are doing. We are preparing, and for this, we will count on your experience, on your support to implement this task at regional level. And for this, we would like to show you what these guidelines are about and what we want to do to update them for the surveillance of yellow fever at regional level. I insist at regional level because at global level, we already have guidelines for other countries where we can also see yellow fever, and I am especially talking about the African continent, and that's why we want to have guidelines for our region, adapted to our region. And that's why this is a work that we are preparing with Dr. Marcordi, and he is now going to talk about the development of the guidelines for the yellow fever surveillance. Dr. Marrondi, his advisor for epidemiology of diseases with potential epidemic impact from the PAHO department here in Washington. Marrondi, thank you for your presentation. Please, you have the floor.
Muchísimas gracias, Jairo.
Thank you very much, Jairo. Thank you for this opportunity to share my presentation. I think you can already see my presentation. I am going to talk about the surveillance of yellow fever in the Americas, and I'm also going to talk about the development of these guidelines, Jairo was mentioning, and the process and the timeline that we are following. First of all, and here I think this is a little bit of a repetition, but I think it is important because it affects the concepts of yellow fever surveillance. We have some general terms, general concepts on the yellow fever disease. As you know, this is a viral disease, acute viral disease transmitted by mosquitoes. To your right, we can see the clinical spectrum that can be found with a yellow fever. The lethality is around 30 to 60%, but if you use the definitions we use for surveillance, we can see that we capture serious cases or cases with fever and or
dentro de estos casos que captamos a través de la vigilancia,
cases. And here in these cases, we have from 30 to 60% of serious cases. This is a preventable disease with vaccination. The etiological agent is a virus of the Flaviridae family with an incubation period from 3 to 6 days. The incubation period is within the mosquito is from within 7 days. I think my colleagues are going to talk about this. The viremia lasts up to 7 days. This is an important period in terms of controlling the infection, because this is a period when the human being is going to be able to transmit from to other vectors. And this is a period where we are going to make sure that we can protect the person from mosquito bites to protect the rest of people. We have three chemical phases that are described in the yellow fever disease. I am not going to describe these phases, but you can see them here in the slide. At the level of epidemiological context, we have 40 endemic countries at global level, 27 in Africa, 13 in the Americas. The transmission cycles are the sylvatic cycle and the urban cycle. We have an intermediate cycle. I am not going to talk about it here, and I am not going to talk about the details of the sylvatic cycles or the urban cycles because they were already mentioned before. But here I would like to have a parallel overview of the measures. In the sylvatic cycle, as you have already heard, we have here a transmission among non-human primates. In the Americas, we have the Hemagogus mosquito. Humans are infected when entering the jungle. And what we see here in some cases, although we can have a high number of cases, we have cases where human beings are infected through a mosquito that needs to infect a human being to infect other human beings. Then human beings are not going to need the transmission. The reproduction is usually made through the same dynamics where we don't have the transmission among human beings. We have also the transmission among human beings and Aedes aegypti, and the number of transmission can go from 5 to 7. Every person can generate from 5 to 7 cases through the Aedes aegypti transmission. This was described very well in an important urban outbreak in Angola. And the outbreaks per urban cycles have the capacity capacity to generate
si no hay un control
explosive
vectorial ni una
situations if we don't
inmunización
have
adecuada. En términos de
control of
medidas
vectors or
de
the
control,
adequate
en el
vaccination. In
ciclo
terms of
selvático
control
es
measures
importante
for the
vacunar
selvatic
a las
cycle,
poblaciones de
it is
riesgo.
important to
No se puede
vaccinate
generar una inmunidad de
populations
rebaño
at
porque
risk.
el
We
huésped primario
cannot
no es un humano,
generate
es un primate no humano que no
the
podemos vacunar, pero la vacunación es muy
protection,
importante para la protección
but it
individual.
is
Es
important
importante también
to have the
implementar
vaccination
vigilancia de
for
epizootias, a veces
the
restringir
we have
el
to
acceso a las
restrict
zonas donde
sometimes
hay
access to
estos brotes
areas
y
where we
educar a las
have
comunidades
these
rurales. En
outbreaks and
contraria del
also
ciclo
educate
urbano, la
rural
vacunación masiva puede
populations.
generar una
All the
inmunidad de rebaño
massive
y
pop-
consideramos que por lo general
vaccination
necesitamos una
can
cobertura arriba del
also
80%
generate
y
the
se
herd
requiere un
immunity
control
with an
intensivo de
important
vectores
coverage, and we
urbanos
need
allá.
an intensive
El nuevo
coverage
paradigma
for
en
the
las
urban
Américas es que
control.
tenemos una
For the
ocurrencia de transmisión por
Americas,
ciclo
we
selvático en
have
entornos
a
urbanos.
transmission per sylvatic
¿Cómo se
cycles in
define
urban environment.
cómo
How
podemos
are we going
acertar que
to
una transmisión se
define
hace por ciclo
or
urbano? Lo que tenemos que
identify
poder
the urban cycle
evidenciar
transmission?
es que
We
hay una
need to have
transmisión
an
por Aedes
evidence
aegypti.
of the Aedes
Entonces,
aegypti transmission.
el espectro de evidencias
The
incluye
spectrum of evidence
infestación
is
generalizada por Aedes
included
aegypti en
in
los lugares
a
de infección,
generalized
una falta de
infection
antecedentes
by
de
Aedes
viaje a
aegypti, the
zonas
lack of
donde hay epizotías por
history of
los casos
travel
detectados,
to
una
exotic
transmisión
areas
secundaria
or
por
where
Aedes
cases were
aegypti dentro de
detected,
la comunidad
secondary
y
transmission by Aedes
idealmente
aegypti
un
within the
aislamiento
community
del
after
virus de
the
la fiebre
detection
amarilla
of a case, and also the
dentro
isolation
de los
of a
del
yellow
vector
fever
Aedes aegypti. Como
virus
se ha mencionado
with
antes,
the Aedes
estas
aegypti
evidencias no se
vector.
han
As
podido
it was
demostrar en las
mentioned,
Américas desde
this evidence was
1954.
not
Sin
shown
embargo,
in the
nos
Americas
mantenemos en
since
este riesgo muy alto de tener
1944, but we still have this
transmisiones,
high risk of having
transmisiones por ciclo urbano por este tipo de
urban
entornos
cycle
que se han
transmissions
descrito
because of
antes,
this
donde
type
tenemos
of environments that were
islas
described before, where
ecológicas
we
en centros
have
urbanos con un acercamiento del
these
vector
ecologic
silvestre, la
islands
presencia de
in
primates no
urban
humanos,
centers
pero
with the
también la
presence of
presencia de Aedes
non-primate humans,
aegypti
but
y
also with the
entonces
presence of Aedes
la
aegypti,
posibilidad de pasar
and also the
de un
possibility
ciclo de transmisión
of
selvático a un
going
ciclo de
from a
transmisión
selvatic
urbano. Por lo tanto, es muy
transmission
importante
cycle
tomar
to an
eso en
urban
cuenta
transmission
a la hora
cycle.
de
It is
implementar
important to
su
consider
sistema de
this
vigilancia.
when
En términos de
implementing the
vigilancia
surveillance
epidemiológica,
system. In
el objetivo
terms of
principal es
epidemiologic
identificar y confirmar
surveillance,
los
the
casos para
main goal is
implementar
to
medidas de
identify
control y prevención
and confirm cases,
y
to
definir la
implement control
presencia
and
de un
prevention
ciclo
measures,
urbano.
and define the presence of a
Para
normal
esto
transmission
tenemos
cycle. For
una cartera
this,
de definición de caso.
a
Aquí estoy enseñando las
we have a
definiciones de
set
caso
of tools
de la
for the
OMS que
definition of
fueron
cases. Here we
actualizadas
have
en
the
2020. Quiero resaltar, de hecho, que hay
WHO
un proceso que se va a
case
implementar
definitions. I would like to highlight
para
that there is a process
nuevamente
to be implemented
actualizar estas
to
definiciones de caso
update
y en
these
particular en el
definitions,
contexto
this
de la
case
región de las
definition,
Américas.
especially in
Un
the
caso
context of the
sospechoso se
region of
define como una
Americas. A
persona con
suspicious
un
case is a
inicio agudo
person
de fiebre o con
with
icteria que
an
aparece dentro de
acute
los 14
onset
días
of
posterior al
fever,
inicio
ictericia,
de los primeros
that
síntomas. Un
occurs
caso
within the
probable es un
first
caso sospechoso
14
con
days
resultados serológicos
after the onset of
positivos
the first symptom.
o un vínculo
Potential
epidemiológico
case is a
con un
suspicious
caso
case with
confirmado.
serological
Por
results,
ejemplo,
or
un caso
confirmed is a confirmed
de fiebre
case,
amarilla o un caso, perdón,
a case of
sospechoso
yellow
muerto, para
fever, a
lo cual no
suspicious
vamos a poder
case
sacar una
from a
muestra,
dead
puede ser
person, and we
considerado
will
como un
not be
caso
able
probable
to
si
collect a
tenemos un vínculo
sample. That could be a
epidemiológico con un caso
potential case
confirmado
if
o
we
con un
have an
brote que
epidemiological
está
link with
ocurriendo.
a confirmed
Un
case,
caso
or
confirmado es un
with
caso con confirmación de
a
laboratorio mediante
a
PCR,
current
aislamiento
outbreak. A
viral
confirmed
o
case is a
serología en
confirmed
muestras
case
pareadas y
in the
para los casos
laboratory through
fallecidos
PCR, viral
registro con
isolation, or
confirmación
serology
con inmunohistoquímica.
with
Esto lo va a detallar un poco más
immunohistochemistry.
Jairo adelante, así que
Jairo is
voy
going
a
to
pasar a la
give you
siguiente,
more details on
que
this
es la
later.
investigación de
And
los
now
casos
I
de
would like
fiebre
to talk
amarilla.
about the
¿Qué es lo que
research
tenemos
of
que
yellow
hacer
fever
cuando
cases.
encontramos un
What do we
caso
need
que cumple con
to
la
do
definición de
when
un
we
caso sospechoso?
find a
La primera
case
cosa que
that
hay que
meets
hacer es
the
una
characteristics
notificación
of a
inmediata a
suspicious
las
cases?
autoridades de
First of
salud
all, we
pública
need to
y en menos de
immediately
48
notify
horas
the
se
public health
recomienda
authorities, and in less
complementar
than
un
48
formulario de
hours, we
investigación,
need to fill out
recolectar
a
muestras de
research
sangre para
form. We need to
la
collect the
PCR
blood
y
samples for
los análisis
PCR
serológicos.
and the
Es
IgM
importante
it is
mencionar que
important to
si
mention
tenemos un
here
resultado
that if
de
we
IgM
have
negativo
the IgM
que fue
results
tomado
that are
antes de los 7
negative, that
días
were
después del
collected
inicio de
before
síntomas,
7
hay que
days
repetir
after the onset of symptoms, we need to
una toma de
repeat
muestra para
the
verificar
sample
la
collection
presencia de IgM
of
que
blood
tal vez
to
todavía
identify
no
the
se han
presence of
podido
IgM
detectar.
that
La
was
segunda
not
parte es muy
maybe
importante, es
detected.
definir el lugar
And the
probable de
second part
infección
is also very important. We need
del
to
caso
define
sospechoso. Eso
the
se hace
infection location of
mirando
the
un poco cuáles
suspicious
fueron
case. And we are going to do this by looking at the
del caso sospechoso durante el periodo
displacement
de
of the
incubación.
suspicious
Hemos
case
descrito
during the
3 a 6
incubation
días.
period. We
Digamos,
have
en la semana
described
anterior al
from
inicio
6
de
to
síntomas,
7
hay que
days,
ver si la
the
persona
week
fue en zonas con
previous to
transmisiones en
the
humanos
onset
con
of
epizootias, es
symptoms.
decir,
We are going to
casos
define if it was in a place
fiebre
with
amarilla
transmission in
en monos, en la vaca, por
humans,
ejemplo, o presencia de vector como
epizotia,
en
or the
ovunos.
presence of vectors.
Es importante también analizar el
It is
contexto en el
also
cual se
important to
detecta
analyze the context
el caso
where
y
the
ahí
case
el
is
lugar probable de
detected.
infección
And
va a ser muy
here,
importante
the
porque es este lugar
potential
que vamos a querer
infection place is
describir
going
en
to be
términos
very
de cobertura
important
de
because this is the
vacunación,
place that we would like
en
to
términos de
describe in
epidemiología
terms
local
of
y de
vaccination
movimiento de la población.
coverage, local
Este tema
epidemiology, and also
de movilidad
mobility and
de la población
population
es importante
connectivity.
también
This
para tratar de definir el
aspect of
riesgo de
population and
propagación de
mobility and
fiebre
connectivity is
amarilla a
important
un
to
entorno, por
define
ejemplo,
the risk
urbano.
of yellow
Y
fever
finalmente
in
se
an
van a
urban
implementar
environment. And
medidas de
finally,
búsqueda
we are going
activa
to
de
implement
casos.
active
Es importante
search of
implementar estas
cases
medidas tanto en los
measures. These
establecimientos de salud
measures are
como según
important.
un
They
proceso
should be
de búsqueda
implemented
de casa a
at
casa
health
y
centers
la
and
búsqueda de
also
primates
at
no
the
humanos
household level
enfermos y
with
muertos
non-primate
en la
and
zona
also in areas with
del lugar probable
non-primate
de infección, pero
humans that
también en
are
las
sick
zonas
or
vecinas
dead,
para ver cómo
and
se va
also
moviendo el
those that
virus.
are in neighboring areas
Finalmente,
to see
es
the
importante
displacement of the
implementar
virus. And
investigaciones
finally,
entomológicas para saber dónde se
entomological
encuentra el vector y otra
researchers
vez
should be
qué ruta podría
implemented to
seguir
locate
la
where the
propagación
vector
del
is
virus.
and also to define
En
the
términos
route
de
of
datos
the spread of the virus. In
que
terms
se
of
tienen que
data
recolectar
that
durante la
should be
investigación de un
collected
caso de
during the
fiebre amarilla,
research of the yellow fever
para
cases,
los datos individuales de
for
cada caso
individual
sospechoso deben
cases,
incluir, por
for
supuesto,
every individual
de
case,
datos
we need to
demográficos,
include
datos alrededor
populational
de la
data,
notificación, de
data
los síntomas
related to the
clínicos, de la
notification, the clinical
vacunación,
symptoms,
del
the
estado de vacunación
vaccination,
del caso. Eso es muy importante
the
para informar
situation,
el
the
programa de
vaccination
inmunizaciones,
situation of the
pero
case is
también datos
important
epidemiológicos,
to
como ya
inform the
mencioné, el lugar probable
vaccination
de
programs.
infección,
And
los
also,
riesgos
as I already
ocupacionales.
mentioned, the
Vemos que
epidemiological data, the
en los
potential
brotes que se
infection
están
place, the
descritos, la amplia
occupational
mayoría
risks,
de los
the
casos
recent
detectados son
travels.
trabajadores
Most of
agrícolas. Eso puede
the
dar
cases
indicaciones sobre
that
cómo
were detected
implementar
were detected in farmers,
actividades
and that can be a
orientadas,
hint to
dirigidas a estas
implement
poblaciones y
activities
también
for this
factores socioculturales que
population, and
puedan ser
also
vinculados a una barrera de
social and
acceso a la
cultural factors
vacunación
should be
o
taken into
al acceso al
account
cuidado.
because
Y en
they could
términos de
be
datos de
related
laboratorio,
to barriers in
datos
terms of
acerca de la
access
muestra
to
como tal,
vaccination
los
or care. And
resultados y
in
la
terms of
clasificación final del
laboratory,
caso como
we need to
confirmado,
see
probable o
the final
descartado.
classification of the case as confirmed,
Además de estos
potential,
datos
or
individuales,
discarded.
durante la
Besides this
investigación de un
individual
caso de fiebre
data,
amarilla
during
es muy
the
importante
research
describir
of
el
yellow
entorno en
fever
el cual
case, it is
se
important
encuentra el
to
caso y
describe the
donde se
environment where
ubica el
the
lugar
case is
probable de
located,
infección
and also
en
where
términos
the potential
de rural,
infection
urbano, condiciones
place
ecológicas,
is in terms
incluso la
of
presencia de
rural,
criadero de
urban
mosquitos, la
environments,
presencia de primates, de
the
cuerpos de
presence
agua
of primates
y
or
finalmente,
water
como describí
bodies, and
antes,
finally,
factores que
as I
podrían
said
facilitar la
before,
propagación del
factors
virus,
that
cobertura de vacunación,
can
conectividad geográfica,
facilitate
carteras,
the spread of the
etcétera,
virus, the
movilidad de la
vaccination coverage,
población
the geographical
y presencia
connectivity,
de
the
población vulnerable.
population mobility, and the presence
De
of
forma
vulnerable
general, recomendamos
population. In
que
general,
el abordaje
we
para la fiebre
recommend
amarilla
to
sea un
have
abordaje integrado,
an
entonces
integrated
con la
approach
presencia y la
for yellow
actualización de protocolos
fever
de vigilancia
with the
epidemiológica,
presence and
como lo
update
mencioné
of
antes, pueden
epidemiological
seguir
surveillance
estos
protocols, as
pasos,
I
pero
already
también tener
mentioned.
protocolos para
We need to follow
la
these steps, but
vigilancia
we
de
should also
epizootias,
have
para la
protocols
detección y
for the
notificación de
surveillance of
mortalidad en primates no humanos y la vigilancia
SOTS
entomológica.
in non-primates for the mobility and mortality in non-human primates and the entomological surveillance. It is also important to have the organization, the integration of data among these health surveillance systems of wildlife, the entomology and the human health. Once we have all this information, we need to organize the information to define the potential risk in neighboring areas, in the neighboring transmission areas. A great way to do this type of triangulation is what we saw in the case of Brazil, what our colleague Daniel already presented. They have predictive models to follow the route of the virus. We saw that at regional level, we have guidelines that are different according to every country with different capacities of implementation for this type of surveillance and control and prevention activities. And that's why now we are working in the development of a set of technical guidelines. We actually have 7 guidelines. We are working in developing a regional yellow fever strategy, including a document that explains the PAHO vision for preventing yellow fever, but it also considers the drafting of 7 technical guidelines. 2 of them are already updated. We are now validating a guideline that is the surveillance guideline that is a more integrated guidelines for the prevention and control of yellow fever. We are now also reviewing 3 guidelines, one for the response to outbreaks, another for vaccination, and this is under the responsibility of our SIM colleagues, and our colleagues from Faraptosa are developing guidelines
regarding the integrated surveillance guidelines and for control of yellow fever. The target public is national and regional authorities. A very complete guideline does not go into much detail for every single one of the components, but it allows at a national level to have an integrated vision of the surveillance activities, preventive activities, control activities for yellow fever. We describe clinical characteristics, diagnosis approaches, laboratory diagnosis approaches, clinical management, surveillance for humans, entomological control, response to outbreaks, risk management. After having reviewed all the existing guidelines, we worked on a draft, and 15 regional experts have worked on these guidelines, global experts. We are currently starting to edit these guidelines, and hopefully we'll be able to publish this in a couple of months. So I want to thank you for this space, Jairo, and if you have any questions, please do not hesitate. Thank you very much, Mark. Indeed, a very important overview. This is something that is ongoing. Of course, we're going to have other spaces to discuss about it. What is important, and this is very important for us, we have to work on a response strategy for yellow fever. There are way too many guidelines globally, many differences among these guidelines. So we need a guideline that is going to adapt to our context here in the Americas region. So you'll be hearing of the development of these guidelines in the next few months. I would like to highlight something very important said by by Mark, all the components of the surveillance, out of all these components, there are two key for us that are not necessarily very developed in the countries in which there are episodic diseases. I'm talking about the episodic disease surveillance. Our next two presentations focus on this aspect. We're going to start with episodic disease surveillance, which is a key factor, as we have been saying, for yellow fever. And for this topic, we have Dr. Renato Alves, who is advisor on veterinary public health in Panaftosa of the PAHO. He is based in Brazil, in Rio de Janeiro. He has worked quite a lot on the surveillance of episodic diseases. He's an expert on the subject. Thank you very much for being here, Renato.
Buenos días. ¿Me escuchan? ¿Se ve bien la
Good
pantalla?
morning.
Perfecto.
Can you hear me?
Adelante.
Do you see my screen?
Muchas gracias, Jairo.
Thank you very
Colegas, un
much,
saludo
Jairo,
a todas y
dear
todos.
colleagues.
Yo voy a aprovechar el trabajo de los traductores y
I'm
en
going
primer lugar
to
en
seize
portugués
this
para
opportunity. I see that there are translators,
que
interpreters.
sea más objetivo. Bem, como já foi
Well, as
falado anteriormente em outras apresentações, a ideia
other
é mostrar
presentations mentioned, the idea
um
now
panorama geral da
is to give you an
utilidade da aplicação
overview
da vigilância
on
epizootica
the
para a
use,
vigilância do
on the
fenômeno.
importance of epizoonotic vigilance for yellow
A
fever.
ideia geral,
Now,
como
the
já foi
overall
demonstrado em outras apresentações,
idea, as
é
other
buscar
documents have shown,
fazer
is to try
a detecção
to
da
detect
ocorrência de um evento de importância
um, the
no
occurrence of
ponto mais
an event of
próximo
importance
possível
as
da sua
closely
ocorrência
as
afastada
possible
dos seres humanos. Ou seja,
to
quando
where
você
it
detecta
happened,
caso
as far away as
humano
possible from human
decorrente
beings. In other
um
words,
simples
when you detect
tetano, uma
a
transmissão
human
por
case
Aedes, ou como já foi falado,
in with a
transmissão do ser
transmission
humano como amplificador do vírus, é
by
dos paramétros
Aedes,
para manter a
when the
vigilância
human being
pró-semática.
is used to
Se essa
further the
detecção no
virus,
ser
this means
humano
that there's a
não
problem in
entrou na área
detection when you only
silvestre e
find it at
terminou,
that point.
possivelmente vai ser uma detecção
When
tardia.
a
Já no
human
caso
being
grave,
has gone into
envolvendo
woodlands and
serviço
become
de
contaminated,
proteção,
it is
e
possibly a
também já
late
demonstra que a
contamination.
transmissão do vírus já está instalada.
This
Ou
shows
seja, o
that the
desejável,
transmission
portanto,
chain
é
for the
que o
virus is
evento que vai
already
disparar
in
ações de
place. So
investigação e de
the
vigilância
triggering
seja,
events
ou
for
acaso,
vigilance situations,
uma detecção do vírus em um mosquito, por
whether
exemplo,
it is
ou
the
seria
virus is
desejável,
detected
mas é
in a
muito difícil em
mosquito,
questão das
which would be
características
the
da
best
vigilância,
case
conseguir
scenario, but it is
operar
very
de
something
um.
that's hard to achieve.
Então, os casos, a evidência da circulação do vírus nos
So in
primatas é o
cases for
melhor
the
cenário,
evidence
o mais
of the
factível,
virus in
mais
primates
efetivo
is the
para
best case
antecipar
scenario possible.
a ocorrência do vírus nos seres
So the
humanos.
idea
O
is
que fundamenta
to
isso, para além
do
da
that before
parte
the
prática,
human
e aqui
occurrences
uso
are
uma
reported.
figura gentilmente cedida pela equipe do
We
Ministério da
have
Saúde do
an
Brasil,
image here, which was kindly forwarded by the
vocês podem
Ministry
ver
of
nesses
Health from
mapas como
Brazil.
exemplo apenas,
As you
isso
can
são
see, this
exemplos de
is an
monitoramento do
example
período
of
2017-18,
monitoring from
a
2017 to
sobreposição
2018. You can
quase que
see that
perfeita
it is an
entre os casos em
almost
primatas acima,
perfect overlap between
círculos
cases in
verdes,
primates, which are shown in
e os
green
casos
above,
em seres humanos
and the
abaixo,
cases in
em
humans, which are
triângulos
shown
vermelhos.
in red
Há uma
below.
sobreposição, portanto,
So
geográfica
they
praticamente
overlap
perfeita, e
geographically
mais
in
importante ainda,
almost perfectly, and even
os
more
casos
important,
mostrados no
the
gráfico
cases
acima
that are
em
shown
primatas
in the graph
antecipam,
above
ocorrem
in
antes,
primates, they happen
são
before
na temporada anterior
in a
em seres
prior
humanos.
season to transmission in
Essas
human
duas
beings.
características da
So
sobreposição e
these
da
two
antecipação
aspects, the
que fazem com
overlap
que essa estratégia de
and
vigilância preventiva
and
seja extremamente
happening
útil
prior
para
get
poder
are
adotar medidas de
what
prevenção
shows
oportunas e
that this is
retardar os
really
limites.
useful
Para que isso funcione
for
bem,
prevention
é
of
preciso uma
yellow fever.
definição de caso. Para a
For
vigilância, e essa
determining the case,
definição depois, que vai envolver
you
todos
need to
aqueles que podem
describe the
notificar, uma
case,
definição muito sensível. Aqui um
and the
exemplo da
definition
definição de
needs to
caso
be
que foi usada
very
no Brasil, para um caso
very
suspeito de
precise.
febre
For
amarela em
example, what
primatas.
is considered as
Qualquer
a
primata, no nome
suspect
de
case in
qualquer
Brazil?
espécie,
Any
encontrado morto,
non-human
inclusive
primate of
vestígios, ou
any
seja, ossos,
species
ou
found
doentes,
dead,
em qualquer lugar do
including
território nacional. Ou seja, uma
bones
definição de caso
or sick,
extremamente
in
sensível,
anywhere in
e esse
national
é realmente
territory.
o
So it
objetivo,
is a
para
very,
que não
very
se perca nenhuma possibilidade de
precise
detecção da
definition
circulação
because we
viral
don't want
antes
to
da
miss any
ocorrência
possibilities of
de casos
detecting
humanos.
the virus
Isso
before it
poderia dar a
manifests
impressão
in
de ser algo
human cases.
quase que inviável ou que
Now, this
sobrecarrega
might seem
demais o
something
sistema,
that
mas
is
o evento de
almost
encontrar um
impossible
primata
to
morto
do,
não é
but
algo tão frequente. Por
the
isso, essa
event
definição
of
extremamente sensível não é,
finding
do ponto de vista
the
operacional, não é
virus in
inviável.
other species is not something that happens all the time.
Além disso,
Besides
para que
that,
funcione bem uma estratégia dessa, é
to ensure
fundamental
that our
envolver
strategy
outros
works in the
setores.
best way
Não é uma
possible,
estratégia
it
que vai
is
funcionar
absolutely key to
só com o
bring
envolvimento
other
do setor
sectors
saúde.
into the fold. We
Então, é
cannot
preciso
operate
informação e
only from the
comunicação
health
para
sector.
coordenar com setores de meio ambiente,
So we
setor
need to work
de saúde
in
pública animal,
coordination,
saúde
in tandem
veterinária,
with other sectors,
para
for
que
example,
os olhos da
animal
vigilância, a
health,
ponta da vigilância, sejam
private
multiplicados.
veterinary
Então, para além dos setores profissionais também, é uma
institutions
estratégia que só
need to
se
be
torna
brought into
efetiva
the
se há uma
fold.
participação de quem está
The only
próximo
way we can be
das populações
effective
primatas,
is
sejam as
when
pessoas que moram lá,
we work
sejam os
with those who
setores que
actually
têm
work
reservas, guarda-parques,
directly with
enfim.
private
É preciso que as pessoas saibam
populations
que esse
and
evento,
also
a
with other
visualização de um primata
animal
morto ou
host
doente, é um evento de
populations.
interesse para a saúde. Isso
We need to
exige um
understand that
trabalho de
finding
comunicação
a
e
sick
preparação muito grande.
primate is an event of
Então, uma
interest to
notificação dessa só
healthcare.
tem sentido
So
também se ela é
when
feita
a
imediatamente, pelo
notification
meio
is
mais rápido
issued, it
possível.
only makes sense if
Não
it's emitted
confundir
and if it's sent out
notificação
immediately
é
or as
informar a
quickly as
autoridade sanitária
possible.
pela maneira
So
mais rápida possível,
notification
seja por meio
is
de
informing
telefone, e-mail,
authorities as quickly as
pessoalmente,
possible
enfim.
by
Da maneira
phone, in
mais rápida,
person, by
comunicar o
email,
evento é
as
muito
quickly as
diferente do registro,
possible.
que é muito importante.
And this is
O
a
registro
different
preciso, com o maior
situation
número de
than
informações possíveis e úteis para a
registering
vigilância é
the
fundamental,
event.
mas não é a mesma coisa que notificação.
But
A
it's not the
notificação
same as
todos podem
notification.
fazer e devem
Registering
saber da importância
is
do evento para
very
fazer.
important, but anyone can
E para além
notify, and
disso, é preciso
everyone must
entender que nem
understand the
todas as
importance of
atividades
notification.
voltadas para a
And to
vigilância de
do that,
epizootias têm
we
que
need
ser
to understand
executadas
that
por
not
todos
every
os níveis de gestão.
activity in epizoonotic
A
vigilance
notificação, sim,
needs to
tem
be
que ser feita por
reported.
todos.
Of
Pelo
course,
serviço
notification
local,
must be done
as
by any
comunidades
and
têm que
everyone.
saber, os
Everyone
profissionais de
needs to be
saúde,
aware,
todos,
any
qualquer
of
pessoa
the
pode fazer esse
people
papel e é
involved in
desejável que faça.
healthcare, anyone
Então,
can play
nesse,
that
nesse
role, and it is
sentido,
actually excellent
deve-se
if they
notificar
do.
aquilo que está definido, uma definição de caso
So
simples, direta e muito sensível.
the
Qualquer
case
cidadão pode
definition needs to be
notificar.
simple,
É
direct,
preciso
and
ter
very
fluxo de notificação muito
encompassing.
claro. A
Any
pessoa tem um
citizen
macaco,
can
ela
do
precisa
that.
saber para
The
quem que ela
flow of notification
deve
needs to be
ligar, quem deve
absolutely
recorrer,
crystal
só para
clear.
dar essa informação.
People must understand and
Deixar
know
claro
who
também que a
they should
notificação
report
é importante
to,
que seja
and
feita
also
imediatamente
make
e mais
sure that
importante ainda,
it is
toda essa
understood that
notificação errada
notification needs to be done
sempre
immediately
deve
at
gerar
once,
uma investigação.
and every notification should
Agora,
have as a
existem outras ações que
consequence
não
an
são todos os
ensuing
níveis.
investigation.
A coleta de amostra dos animais
Collection of
exige
samples
capacitação.
from animals
É uma capacitação
requires
relativamente simples,
capacity
qualquer
building.
profissional de
Any
saúde ou que
professional
seja
is
envolvido
from
com
the
o meio
healthcare
ambiente pode
field
fazer,
or who works in with the
tecnicamente é
environment
possível,
can technically
mas ela deve ser
be
ágil, ou
trained
seja,
to
quanto
do
mais
that, but it needs to
capilarizado,
be
quanto
done
mais
as
distribuído,
quickly as possible.
pessoas
In
capacitadas
other
para fazer
words,
coleta, melhor.
the the highest number of people who have had capacity building to collect these samples, the better. Now, entomological investigation requires expertise, specific expertise, and eco-epidemiological investigations, which have to do with active searches, is complex, it is expensive, it is not done on a regular basis, and in this case, we really do need a central team who works with this. So this establishes a sort of hierarchy in activities. Which are the key steps? Firstly, find it, prove the existence of the epizoonotical event. Sometimes it's not that easy. This notification should ideally trigger an in loco, in place search for information. The community should be heard. Communities know, and people who know the groups of primates, especially for large size primates, the people who live nearby know these groups. So it is absolutely key to make the best use possible of logistics for places, for example, that are hard to reach. And work must be done in tandem with, for example, the vaccination teams. Now, no matter which stage of decomposition the body of the primate is, the remains must be collected and pictures must be taken, geolocalization. We need to try to get as much information as possible.
It's also important to make monitoring, to work on the monitoring. Immediate action is important, and the update of all these actions, outbreak progression, reassessment of actions and recommendation, and if necessary, change strategy and definitions. It's also important to work on the reporting and communication. Communication should also seek to protect monkeys or primates and reinforce the message that they do not transmit the disease because primates are transmitting. It's important to pass the message that they are also victims and an important ally in preventing human cases. Transparent and careful reporting. This is something helpful for communication being effective and aiming to inform and at the same time not to cause panic. Participation of communication professionals in technical meetings, conference, research. To end, apart from all these items, it's important to focus on a complex activities. All activities related to epizootic surveillance and entomological surveillance are priority at all times during an outbreak. The first detection in most cases can be followed by other detections in other animals. The most complex investigation once we have defined that there is transmission in a specific locality is not as relevant as the first identification. So the encouragement for notifications and communications of events of interest should never cease. Once we have achieved the participation, this encouragement, this motivation should be there. We need to understand that this transmission is happening and this encouragement should prevail because it's the collection of information will be useful for other approaches.
Se não é possível realizar a investigação completa
If
pelo acordo de
investigation
notificações,
is
por
not
exemplo, ao
possible,
menos a geolocalização do evento é fundamental que se
geolocalization
faça.
of the event is important.
Sempre buscar coletar amostras. Mas
Always seek to
uma
collect
coisa muito
samples.
importante,
This
se
is a
no
very
meio
important thing.
de uma transmissão grande,
If in the
um grande
middle of
surto,
a
há
big
acúmulo de amostras,
transmission
é
after
preciso o
the
laboratório
outbreak,
trabalhar
it's
muito em
important that
conjunto, eu
the
sei que você
laboratory
fala um pouquinho
works.
sobre o laboratório, trabalhar muito em
It's
conjunto com a
important to
vigilância
consider
para
laboratory
priorizar as
capacity and
amostras naqueles
prioritize the
locais onde ainda
processing
não
of
se tem
samples from
informação se
new
há
areas
circulação ou
which
não.
do not yet have confirmed transmission.
Então, essa ação implementada,
So the
disseminada,
implementing
funcionando
all these
adequadamente, ela
actions,
representa a qualificação da informação e possibilita
and with
outras
this,
abordagens mais complexas e sofisticadas
the
de modelagem e
increase
predição, como
is
já
an
foi
increased quality of
mencionado,
surveillance with
alguns exemplos
qualification of
aqui,
information, predictive and
e
probability
também
models,
exemplos
and
da experiência
basis
do
for
Brasil,
effective
de
laboratorial.
modelagem,
This is
modelos
an
de
experience of Brazil
favorabilidade da transmissão da doença a partir de dados, de pontos de dados
from data
georreferenciados de
in
ocorrência de
differentiated
casos em humanos e cães
areas
primatas, e
in
aqui também
primates.
análise
And
filogenética,
here
podendo
we
demonstrar
have
progressão do vírus
the
em função
progression of the
também,
virus
tudo isso a
and all
partir de uma
this
informação
from
abundante e
abundant
qualificada.
and qualified
Muito
information.
obrigado,
Thank you
eu
very much.
fico à disposição para
And I'm here
responder
to
por esse
answer
e-mail, se vocês
your
tiverem
questions. This
interesse,
is my
podem
email
mandar.
if you were
Infelizmente, eu tenho
interested.
que me ausentar agora,
Unfortunately,
mas eu sei que
I
os
need
colegas
to
todos aí
leave this meeting,
estão
but you
mais do
have
que
all my colleagues here
capacitados para
who are
abordar
more
não só a epizootite, mas
than
como todo ciclo de
than
vigilância safena-marinha.
qualified
Muito
to help you
obrigado.
with your
Obrigado,
questions. Thank
Jairo.
you.
Abraço.
Thank you, Jairo.
Muchísimas gracias, Renato.
Thank you very
Sí,
much,
efectivamente,
Renato. Indeed,
sabemos que te tienes que retirar,
we know
pero
that you
cualquier
need
pregunta que
to
no se pueda
leave,
responder, por
but
supuesto, te las
if
vamos a
there
pasar.
is any questions,
Muchísimas
we'll
gracias
be
por tu
sending it to
presentación.
you. Thank you very much for your
Creo que ya lo hemos estado
presentation.
comentando.
I
Son
think
muchos
we've
los
already talked
componentes de la
about it. There are
vigilancia y la
many
respuesta
components
que
to
forman parte de una
surveillance, to
buena,
response, that are part
de un
of a
buen
good
trabajo
work,
de vigilancia y preparación. Y en
surveillance
el
and
caso de las
preparedness
episodias
work.
es algo
And
que,
regarding
insisto, hemos estado
episodic
tratando de
diseases,
trabajar.
this is something that
Hace
we've been trying to
poco,
work on.
precisamente, estamos trabajando
Recently,
con el
we've
Ministerio de
been
Salud de Colombia
working
también
with ministries of health,
para
of the Ministry of
fortalecer esa
Health in
vigilancia
Colombia to
de episootias
strengthen
y
this
queremos hacer lo mismo
episodic
en otros
disease
países en
surveillance. And
donde
we
podemos
want to
tener
do
situaciones
so also in
similares.
other countries in
Pero
which we
en
can
en
carry
este
out
área y
similar
en
activities.
este escenario que
In
bien,
this
bien lo comentaba
scenario,
Renato, ya lo
as
hemos
Renato
visto
was
en varias
saying, we've seen
presentaciones,
this
hay una
in the
interfase
past or in
precisamente
different
en donde son
presentations. There's
varios
an interface
los componentes
in
que pueden
which
llegar
one of the
a generar
components
brotes
that can generate
importantes de fiebre amarilla
outbreaks
y
of
muy de
yellow
la mano
fever are present.
con la
And this
vigilancia
goes
precisamente de las episodias y lo
with the
comentó también
surveillance of
Renato, viene la
episodic
vigilancia de otro
diseases.
componente clave
We need
que
the
son los
surveillance
vectores
of another
precisamente.
key
Y en
component,
ese
which
sentido,
are
y
the vectors.
para hablar
In
precisamente
this
de la
regard, to talk
vigilancia,
about
trabajo y control de vectores,
the control,
tenemos hoy
vector
al doctor
controls,
Haroldo Becerra.
vector controllers,
Doctor Haroldo Becerra es
Dr.
asesor de
Haroldo
epidemiología y salud
Becerra is
pública
advisory
de la Unidad de Enfermedades
in public
Tropicales
health
y
of
Transmitidas
the
por
tropical
Vectores del
diseases
Departamento de Prevención, Control y Eliminación de Enfermedades Transmisibles
unit
de la
transmitted
Oficina de
by
OPS
different
Regional de
vectors in
Washington.
the
Muchísimas
PAHO
gracias,
office in
Haroldo, por
Washington,
aceptar esta
regional
invitación
office. Thank you very
y tienes
much.
la palabra.
Dr. Haroldo, you have the floor.
Muito obrigado, Jairo, e agradeço eu o convite para
Thank you very
participar
much,
desse
and thank you for
importante
inviting
webinar.
me
E, por favor, me confirma
to
só
this
que vocês
important
podem ver
webinar.
minha
Please let
tela.
me know if you can see my screen.
Ainda não.
Not yet.
Ok? Vocês conseguem?
Ahora sí.
Can you
Ok,
see my screen now?
muito obrigado, Jairo.
Thank you,
Bem, o tema que eu
Jairo.
vou trazer hoje para a nossa discussão aqui é o
What I'm
tema da
going to bring for
vigilância
discussion
entomológica, né?
is
Olhando os aspectos envolvidos na
this
vigilância da febre
entomologic
amarela e
surveillance
ações de
and vector
prevenção e
control
controles que
of yellow
podem ser
fever and
implementadas,
some
né? Eu
controls that
iniciaria
could be
minha
implemented.
apresentação trazendo novamente que muitos dos colegas
Once
já
again,
apresentaram aqui,
let
mas eu
me
queria
repeat
fazer
what
esse
other
destaque
colleagues mentioned, but
na
I wanted to
importância da
highlight
distinção
the
desses ciclos, não?
importance
Nós
of
temos dois
the
ciclos para a febre
differentiating
amarela, um ciclo
cycles. One cycle
silvestre,
for
ou periurbano
yellow
ou
fever,
rural, onde o
sylvatic,
domínio aí se encontra
rural,
basicamente
where there is
entre os hemagogos e
a
os
focus
mosquitos do gênero
on
hemagogo e do gênero sabetes, E temos um
hemagogus
ciclo
mosquitoes,
urbano,
and there is an urban
onde
cycle where
domina
there
os
is
mosquito aedes. E
a
aí
focus
também,
on
não só o
Aedes
Aedes aegypti, mas
aegypti.
aparece um
Not
outro
only
mosquito
Aedes
que nós
aegypti, but
encontramos na
another
nossa
mosquito
região,
that we can find in
assim
our
como o Aedes
region
aegypti, bastante
that is
disseminado, que é o Aedes albopicto, e ele
quite
aparece
scattered,
aí com uma possível
and
ponte, ou fazendo essa
which
ponte
is the
entre
source
o ciclo silvestre e esse
between
ciclo
sylvatic cycle and
urbano. Então,
urban
para a gente
cycle.
entender
To
essa dinâmica
understand
da
this
transmissão, primeiro é
dynamics on
partir de que
transmission, let
esses
me start by
vetores
saying these
necessitam realizar um
vectors
reparto
required
sanguíneo, não? Em,
to have to pass
em
through blood
mamíferos para que possa
in mammals
avançar no seu ciclo
so they
biológico.
can progress in
E
their
eles
biological
ocupam
cycle, and
cotas
they
diferentes. Então, esses são,
go
são
to
coisas
different
marcantes
bodies.
que é preciso
So these
entender
are
para,
important
no processo de
aspects we need to
vigilância, assim
understand
como
in the
falou
surveillance
anteriormente o
process.
colega, tem
As the colleague
diferenças
mentioned,
marcantes que nos
these are
ajudam a não
marking
só
differences,
identificar
important
locais de transmissão, mas
differences
também
which allowed
buscar
us to
incriminar
understand
os
differentiation
vetores
and
e
discriminate
envolver esses
different
possíveis
vectors.
reservatórios. Se a gente olha aqui
If
para
we
os
saw
vetores
the
silvestres
picture,
aí dos hemagogos
these
sabetes,
vectors
vejam por
and
favor as
the
duas fotos, e vocês vão
hemagogus
ter diferentes
and the
níveis no
sabetes,
extrato
you can
vertical
see
dessa
that there
área
are levels of the
preservada, dessa área
vertical
silvestre, onde se encontram esses
levels
vetores, que vão
where
desde a
these
copa das
vectors
árvores
are
até
found.
o solo. E eles utilizam
And they are
basicamente
used
essas
basically, they use
estruturas
basically these
naturais,
structures, these
né? Sejam
natural structures,
axilas, sejam outras ocos nas árvores, como seus criadouros.
trees,
E no outro extremo,
and
nós temos aquele
on the other
vetor
hand,
bastante
they also
adaptado, né,
have this
ao
an
ambiente urbano
adapted
Aedes
vector,
aegypti, que
urban
utiliza
vectors
basicamente
for the Aedes
reservatórios
aegypti
artificiais como seus
artificial
criadores, ou seja, ele está intimamente
reservoirs.
relacionado
So this is
à vida humana, no
connected
intradomicílio ou
to
urbano.
the
E temos
urban
aqui o vetor, um
environment.
outro possível
And
vetor,
we
aquele que faz
have
a
the
ponte, o Aedes
other
albopictus,
possible vector
que está
for
na
the
franja
Aedes
entre essas duas
albopictus
áreas. Ele
that is
pode
in the middle
utilizar
of these two
tanto
areas. Aedes
os criadores
albopictus
naturais, mas também já temos
can
registro
use
dele
these
utilizando
natural areas, but we also have
criadouros
records
peridomiciliares já
of Aedes
de
albopictus
natureza
using
construída pelo homem, ou aqueles que
urban
estão mesmo dentro das
reservoirs,
residências. Então,
urban
a
areas.
importância
It's important to
entomológica e
understand this,
epidemiológica desses vetores para um processo de
the importance
transmissão,
of these
seja ele
entomological vectors
no ambiente silvestre, onde esses vetores aqui
is
mantêm
interesting
sítio, ou
because
seja, eles
all these
fazem com
sylvatic
que o vírus se
or
mantenha
urban
nessas
areas
populações de
help us understand
reservatórios,
these
passando
populations
dos
according to.
indivíduos doentes para os indivíduos sãos, ele também
So
favorece,
it's
pela
important to
necessidade do repasto,
understand
também
that
pode fazer repasto em um humano não vacinado, e aí,
they
consequentemente,
can
transmitir o
also
vírus
be
a essa
in
pessoa, e
non-vaccinated
pode fazer a
humans or
ponte com
vaccinated humans, which can be
ambiente urbano,
when the
pondo em
human
risco
being
aí a
is infected,
transmissão, levando a uma transmissão urbana.
so in
A
the
importância
human
dessa
environment that is
vigilância,
urban, so the
primeiro,
importance
ela é uma vigilância
of
integrada.
this
Nós estamos
surveillance
falando de
is
vigilância
that
de casos, estamos
we need
falando
to
da
have
vigilância dos
a
primatas no
comprehensive
humano.
surveillance
Aqui a vigilância
houses
entomológica,
of
ela contribui nesse
human
processo. Ela é
primates and
essencial para que
also
a gente
this
possa
entomological vision.
avançar não só na
This
determinação dos
contributes
locais
to
de
progress
provável
in
infecção, mas também
determining
para determinar a
the
distribuição
infection
desses vetores, que vetores estão
areas and to
envolvidos, se
determine
eles
the
são
distribution of these
silvestres, em
vectors
quais
and
áreas que
how
eles
they
ocupam.
are
É
related,
importante
whether
também
they are sylvatic and in
que
what
essa
areas they
investigação
are found.
colabora,
So
né,
it is
na
important
detecção
that
dos vírus,
all
que
this
vírus está
work
circulando. Isso é chave para que a
could
gente possa estar
detect viruses
construindo, né,
which are the ones
recomendações
circulating so
para a
we can
resposta,
build
e também, assim
recommendations
como
and obtain
falou
responses.
Renato, né, como a
And
circulação
as
antes
Renato mentioned,
nos primatas, e elas são detectadas com esses indivíduos
we
mortos, também nós
have
podemos utilizar essa
this
vigilância para
primate
tentar
circulation,
antecipar
and we can
a
also
detecção
use this
dessa circulação do
surveillance to
vírus, né? E
identify
os tipos de vigilância que
virus
nós
circulation.
temos
There
basicamente, para falar
are
mais dois tipos de
surveillance
vigilância.
types,
Uma muito
two
mais
surveillance types.
sistematizada no ponto de vista da sua
One
continuidade, que nós
of them
chamamos de
is more
monitoreio
systematized,
entomológico, onde nós temos, né,
regarding the
monitoramento entomológico,
entomological
áreas sentinela,
monitoring,
se estabelecem áreas
where
sentinelas
we
dentro dessas
have
áreas conhecidas de transmissão
sentinel sites which
para
are
monitorar
within the
a
transmission areas
distribuição
to
temporal
monitor
e espacial dessas populações
the
de vetores.
temporary
Então,
and spatially
com
and
essas
temporally
medições
monitor
está
populations of Culicidae with vector
antecipando a
potential,
propagação desses
and to
vírus nessas
define
áreas.
areas with
A
potential for transmission
definição
and provide
desses
evidence for the
potenciais
design
transmissores
of
também
preventive
e
measures,
aportar, né, para definir essas
and
áreas
also
e aportar
define
com evidências
these
quais seriam
areas
as medidas mais
and to have
recomendadas para a
evidence
prevenção e
on the
eventualmente um controle.
measures that
E
could
detectar, claro,
be more efficient for
a
proper
detecção
control,
desse vírus,
and to
corroborar não, que
detect
esse é
in
o
an
mesmo
early
vírus que está
manner
circulando nos primatas não
the
humanos
viral
e,
circulation
consequentemente, ver também se esse é o mesmo vírus que está circulando
in
nos
primates
humanos.
and
Isso
humans,
é essencial para, né, toda
and if it is
a
the same virus.
resposta
This is
para
important
essa transmissão. As
because with
investigações
this we will
entomológicas,
have a
elas
response regarding
são de
transmission.
caráter
We have
mais
the entomological
associada às
research,
investigações que estão sendo realizadas
which are
tanto para os
activities
primatas
triggered
não
by the
humanos ou
notification
para
of
aqueles casos
epizootic in
suspeitos em
non-human
humanos, né?
primates
E isso
or
tem
suspected
uma
human cases
importância
of yellow
chave,
fever.
porque, por exemplo,
This is important
a vigilância entomológica colabora no
because
processo de descarte e confirmação de
entomological
casos. Não é decisivo, mas
surveillance
se
could
junta toda essa
support
informação
the
recopilada desde a
classification of the
história
investigated
epidemiológica do
events,
caso, desde o
and
encontro
to have
dos
the
primatas não humanos
input this
mortos,
information from
todos os
the
testes realizados
non-humans
nos pacientes, isso
um,
é essencial para ajudar
dead
a
non-human,
identificar se o vetor, o
so we
possível vetor está
identify
naquela
if
área,
there
e isso
is
ajuda,
a
né, no
vector,
descarte e
and if
confirmação
this
dos
vector
casos.
is in the
A
area, and with that
outra
we
coisa
can have
importante é
more
que, às
confirmation on
vezes,
cases.
mesmo com todo esse
Another thing
trabalho de
is
vigilância, de
that
investigação, não
with
se
all
conseguem
this
as
surveillance
amostras
work,
adequadas,
sometimes
não se
we
tomam as amostras no momento oportuno e os
don't
resultados
have
das análises às vezes
adequate
não são
samples,
conclusivas e aí
and
estou
the
colocando o caso dos
analysis
humanos e
results are
primatas
not
também. E
conclusive.
a questão da vigilância entomológica entra aí como
And we also
uma
have
informação também que auxilia nesse
information
processo de
is that
determinação
in the
com uma
determination
alternativa para que
process,
se possa avançar nesse processo de
so we
investigação
could
e chegar,
continue with this
né, a
investigation
descartar ou confirmar o caso ou
to
ajudar
confirm or
na
rule out
identificação
or to
da
identify
provável local de infecção desse caso, né? E
infection case.
claro que essas ações de vigilância entomológica,
All
elas
these
acompanham as
entomological
ações
cases
de
go
controle
along
ou de
with
prevenção.
control and
Alguns
prevention
exemplos aqui, e
situations.
aí trago para vocês o papel da vigilância entomológica e, às vezes, as dificuldades que ela encontra. A vigilância, né, que se faz
Now,
nas áreas silvestres,
surveillance,
ela é uma
which is
vigilância
done
bem
in wooded
especializada,
areas,
que
is
às vezes
specialized in
necessita que o
nature.
profissional
And
tenha
sometimes
destrezas
the
que não é comum a
professional
todas as pessoas para
needs to
poder
have
fazer
um,
essa captura no
skills that are not
extrato
nor
vertical
that
das
people don't
matas, né?
normally have,
A outra coisa é a
especially when you're
utilização de
capturing
equipamentos com armadilhas
vertically in the
muito mais
woodlands. The
elaboradas, com
second
liberação
thing
de
is
CO2, e há
using
uma série de
elaborate
estratégias
traps
que
with
auxiliam
CO2 emission. There are a host
nessa
of strategies
investigação
which really
e
support the
recoleção de
investigation process
indivíduos no
and
ambiente
the
silvestre. Já
collection
no
of
ambiente periurbano e
individuals
urbano,
in woodlands. Now,
essa
in
vigilância
urban and
utiliza muito da
peri-urban
vigilância que nós já
spaces,
temos instaladas
surveillance
para os
really
vetores urbanos, no
draws
caso
on
Aedes aegypti ou Aedes
previously
albopictus, que pode
standing
ser feita
urban
tanto
vigilance
através da identificação das larvas que
systems.
são levadas ao
So we can
laboratório,
identify
podem ser feitas através de
larvae
aplicou
in
que na
labs,
trampa, mas
and
poderia
what
ser
I
também outro tipo de
show, as
armadilha.
I show
Com,
on screen,
nós
other
temos
types of
outros tipos que
traps.
podem
There are
ajudar
several
também,
types
como
of
a
traps that
captura de
really can
adultos, e aqui
help
eu também
for capturing
também a
adult
coleta,
specimens.
coleta direta de
And
adultos. Isso
Of course,
pode
you can
ser,
directly
são as
collect
alternativas que
the
há, sendo que a
adult
coleta de adulto é
specimens.
muito
These
mais
are several
utilizada naqueles
alternatives.
momentos que nós
What we
estamos com
normally do
suspeita de um
is
caso
when you
e
have
queremos
a
detectar se
suspicion,
a
when you're
presença
trying
do
to
vírus
detect a
nesses
case,
vetores.
when you're trying to detect a virus,
Queria
you
fazer
normally
algumas
go towards
considerações sobre
collecting
a
adults.
vigilância
I'd like to make
entomológica
a
para que
few
ela possa ter
observations on
qualidade e
entomological
melhorar as ações de monitoreio.
surveillance and vigilance
Tem alguns pontos que eu acho que tem que
because,
entrar,
and
que
it's
creio que nós outros
important.
devemos tomar em
Three
consideração.
things
Deles
we
é a
should
disponibilidade de
really bear
recursos,
in mind.
para
First
estabelecer
is
essa vigilância, não
availability
só
of
os recursos
funds to
humanos, mas
establish the
materiais e
vigilance,
financeiro,
not
e
only
ter,
human,
claro,
but
apoio
material and
logístico
financial
para
resources, and also a
toda essa
logistic
vigilância, né?
support
Ter os
for our
procedimentos
surveillance
padronizados,
efforts,
do ponto de vista
having
operativo para captura
standardized
e monitoreio
procedures from
desses
the
vetores.
operational point
E
of view for the
aspecto
capture
muito
and
importante é a
monitoring of
vinculação
these
dessa
specimens.
vigilância
And a
nas
very
ações de
important
resposta e
issue is
prevenção, e
bringing these
tendo essa
actions in
resposta
the
como uma resposta
prevention
integrada de
and
todos os atores envolvidos, né?
support
Fortalecer o
actions
trabalho coordenado
working in
em
tandem
coordenação com
with
as
all of
redes,
the
as redes de
involved actors,
laboratório. E
working
outro processo
with coordinated efforts
importante
with
o processo de
labs, with
análise
other
dessa
labs
informação,
and
né?
other networks.
E isso
Another important
facilita quando
step
você
is
tem
analyzing the information. This is much
padrões
easier
de
when you
metodologia de
have
análise que
standards,
facilitam as comparações, o
methodological
estabelecimento
and
das
analytical
áreas de
standards,
risco,
which really
e isso
support
auxilia em todo o processo
and
de
help
vigilância, prevenção e controle.
the vigilance
As ações de
processes in
prevenção
risk areas.
em áreas de
As
risco
for
febre amarela,
prevention activities
aqui uma
in
divisão em
yellow
duas
fever
áreas
risk
selváticas e
areas,
rurais,
there
e
are
urbano
two
e
main
periurbano.
types of
Primeiro,
areas,
falar pouco da selvação, onde
woodlands,
não
rural,
temos
and
a possibilidade de fazer o
peri-urban and
controle
urban.
direto do vetor,
First,
ou seja, nem
let's work
nesses ambientes
with
não
the
é viável
wooded and rural
tecnicamente que
areas when you
possa
cannot
fazer controle direto
technically
desse vetor utilizando as metodologias que nós
directly
utilizamos, por exemplo, para os
control the
vetores
vector
urbanos, como
using the same
controle
methodologies we use, for
de criadouros
example,
com
for
larvicidas ou
urban
aplicação espacial
environments, which is
de inseticidas ou
controlling
mesmo
possible breeding sites or topical application of
controle através de aplicação
insecticides
residual. Mas
or control through
há estratégias
residual
que
applications.
nós podemos
However,
estar
there
pensando
are
nelas, né? A primeira
strategies that we can consider
seguramente
for
uma
these
das mais
rural or
importantes,
wooded
e tanto
areas. Firstly,
nas
one
áreas
of the
urbanas como
most
periurbana, como
important,
nas
both for
silvestres ou
peri-urban,
rurais,
urban,
é a
wooded, or
vacinação dessas
rural
pessoas, né?
areas,
As pessoas
is
dessas áreas que vivem nas
vaccination.
áreas de risco, ou que têm
Vaccination of
indicação pelas autoridades de saúde que
people who
usem, que
live
utilizem
in
a
high
vacina, que
risk
estejam
areas or
vacinadas, é
who have
importantíssimo que
been
elas estejam
have been
vacinadas para não ter
pinpointed as at-risk
uma medida de
at-risk
prevenção
populations
contra
by
essa
the
infecção.
Ministry of Health
Há
is
outras
key
alternativas
in
é a
preventing the
utilização
infection.
de
Other
repelentes ou roupa que
alternatives is
cubram o corpo,
using
que servem como
insect
barreiras para
repellents or
o vetor
clothes that
não
cover the
realizar o
body,
repasstamento.
which
E
are
o outro
physical
também, que se por
barriers for
acaso
the
as
vector.
pessoas têm que
And another
permanecer
one
nesse ambiente
is
durante a noite,
if
que elas
people
utilizem
need to remain in the
mosquiteiros que
environment
protejam
during the night, is the use of
evitem um contato,
mosquito
seja uma
nets
barreira no contato
to
desses
try
vetores com
to
essas pessoas.
avoid contact with the
Uma
vector.
coisa
So it's another
particular
physical
é que
barrier.
nessas áreas
A very
silvestres
specific
ou rurais,
issue
podemos ter
is
pequenas
in these
comunidades, refúgios
rural or
temporários,
wooded
acampamentos,
areas,
bases operativas.
when you have
E aí, como essas são estruturas que
when you
estão
have
permanentes nessas áreas, o uso de
places that
malhas
are not
mosquiteiras,
permanent campings, operational
nas
bases,
portas e nas janelas,
is always try
nas
to
áreas nas
in
frestas
the
que possam dar entrada
structures
a esses vetores é
have
importante. E em alguns
screens
casos,
and
né,
barriers
quando se
to
faz uma
hinder the
boa
vector
análise
from entering
técnica
the
de
premises.
viabilidade
And
e
when you
de
have a good
oportunidade
quality type
e de
of
capacidade
analysis
e que
for
haja condição de fazer,
capacity,
se utiliza
and when
pode-se utilizar
you can
inseticidas
do that, you
em
can
essas
use
pequenas
insecticides.
opções que eu falei para você.
These are a
E
few
nas zonas de
options
risco
that
durante
I mentioned. For
essas
the
a ocorrência
at-risk
dessas
areas,
epidemias, né? Vou
when
colocar
the
aqui
epidemic is
parques,
underway, for
áreas de
example, parks,
de turismo que sejam que
or
possam ser
places where tourism
controladas, o acesso
is
pode-se tentar controlar o
ongoing.
acesso das pessoas, como por
We
exemplo
can also
já
try
houve
to
locais em
control
que
access
as
of
pessoas para terem
people to these
acesso
sites to
necessitavam
make sure that,
de
as an
apresentar
example,
uma comprovação de vacinação.
people needed
E nas
at a
áreas
certain place to have
urbana,
access to a given
periurbana,
area, they
além
needed to
das
show they
ações
had
que
been
nós falamos,
vaccinated.
né,
Now,
que são as
for
ações
urban
de
and
proteção
peri-urban
pessoal, essas
areas,
estratégias
besides
de
those
controle direto do
personal
vetor são
protection
aquelas
activities that
que
I
se
mentioned
utilizam para
before, the
o
direct
controle do
control
Aedes
of
aegypti e do
vector
Aedes albopicti, que estão enmarcadas no manejo
activities
integrado de
are the
vetores,
same
que vão desde as
as for
intervenções,
Aedes
né, de
aegypti and
mobilizar as
Aedes
comunidades para reduzir as
albopicti.
populações, ou seja, eliminar
So the
aqueles possíveis
idea here
criadores
being
dentro ou ao
eliminating
redor das
possible
habitações ou
vectors,
outras
so
edificações,
doing
o controle
awareness
físico desses,
campaigns with the
criadouros
populations,
ou
the
controle
physical
biológico podem
control
ser
or
utilizados
biological
nesses
control of these breeding
recipientes
areas
artificiais
are
quando o
important.
manejo não é não é
You can
realizado,
use
né? A outra
artificial
alternativa também é a
breeding
aplicação de
points for
inseticidas de forma
control
espacial ou de forma
with
residual.
these
Há
resources. Another possibility
uma
is
série de
residual or
documentos que
topical
suportam as
application of
técnicas para essas
insecticides. There are a
aplicações estão
series of
disponíveis
documents that
nas
support this
secretarias
type
de
of
saúde
applications, which are
das
available in
localidades ou nos
the
Ministérios da Saúde e
health
também
departments
no
of
nosso
these
site
places or
de
through the
manejo
Ministry
integrado
of
de
Health
vetores da Organização
or in
Pan-Americana da
our
Saúde.
site of
Ah,
integrated management of
tema que se
vector
falou
in
muito aqui foi o risco de
at
urbanização
PAHO.
da febre
An
amarela,
issue
né?
that
E
was
tem uns
mentioned before
fatores
is
que
the
estão
risk that
associados a esse
urbanization
risco, né?
brings
As
and
pessoas
the
que não
associated
estão vacinadas
factors
que entram
of
nessas
this risk.
áreas, né?
Firstly,
Que são
unvaccinated
áreas
people
endêmicas.
who
Isso
enter
é
areas which are
fator que leva
endemic.
ao risco,
This is a
de
factor
uma
that
reurbanização
brings
quando essas pessoas
risk
retornam
in
a áreas
reurbanization when these
urbanas
people come
onde há a
back
presença
to urban
desses, principalmente
areas
do Aedes aegypti e
where,
Aedes albopicti.
especially for
Essas
Aedes
são
albopicti and
condições para que
Aedes
possa
aegypti, this
ocorrer a
is a real
reurbanização
risk.
ou
These are
alterações do
conditions
ecossistema
that
por
bring
atividades
the virus
econômicas que
back into
também
urban
fazem com que
areas,
essas
or
populações
also
tenham que entrar
changes in
nesses
the environment
ambientes e,
of economic activity,
consequentemente, aumentar o risco de
etc.
contato com
So
os vetores e
populations
com o vírus, né?
begin to
O
enter these
crescimento das
places
cidades,
where
essas
the
cidades
virus is
agora
endemic.
estão
The
muitas vezes
growth
ao
of cities
borde de
is
áreas
also a risk factor. Cities
mais
now
rurais, mais silvestres, e
are
isso
really
aumenta
have
a possibilidade
expanded
de
and
contato
they
desses vetores. E
are
como eu falei para
sharing
vocês, também nessa
boundaries with
franja aí
rural
se
or
desenvolve
wooded
muito bem
areas.
o Aedes
And in
albopictus, né?
these
E um
fringe
outro fator é
areas,
que
this is a
algumas
great
vezes
place for
as
Aedes
áreas onde
albopictus to breed. And
estão em
sometimes the
baixo risco, elas
areas
não estavam
that are
no
low
rol
risk
daquelas que
were
tinham
not
indicação de que a população estivesse vacinada.
listed
Isso pode ser um fator também
in the
que trabalha a
vaccination
favor do risco de transmissão urbana. Mas
in
eu
the
queria,
vaccination
já estou também
areas.
chegando
So
próximo ao
this
fim
is
da minha
also
apresentação,
a risk.
trazer
Now I'm almost at the end
esses
of my
aspectos aqui para que
presentation, and
nós
I'd like to
tivéssemos em
mention
consideração. O primeiro é
some aspects that
caso
we
suspeito de
need
febre
to
amarela em
consider.
ambiente urbano.
First,
Quando a gente
a,
vê esse caso,
a
o Rony
case,
falou
a
muito bem
suspect
disso, né?
case of
Que esse
yellow
caso
fever
pode
in
ser um
urban
caso que
environments.
não se deslocou
Now,
para nenhuma
as
área
was mentioned very
e pode ser um
competently
caso que sim se
before,
deslocou para uma
either
área
this case is a case of a
conhecida
person
como
who
de
went
transmissão de
to
febre
an
amarela,
endemic
então a
areas
investigação
or a
rápida e
person who did
oportuna
not. So
dessa
the
situação
quick
ajuda
and
muito.
timely
E se essa
investigation of the
área em que a
situation is
pessoa foi,
really
essa
important.
cidade, é uma cidade
If that
que tem
the
a
city
presença
in
do
case is
mosquito
a
Aedes, seja
city
ele o Aedes
where
albopictus ou Aedes
the
aegypti,
Aedes
é necessário que se
mosquito is
pense
present,
em
whether
ações de
Aedes
controle
albopicti or
para fazer
aegypti,
o bloqueio da
you really
eventual
need to
transmissão
work
urbana.
with
Então, os
control
locais
measures
importantes,
to
primeiro, a
hinder
casa dessas
urban
pessoas.
transmission.
Recordem, vou dar um exemplo de uma
I'll
pessoa que
just give
faz
you
um
an
ecoturismo, ele
example.
passa o final
A
de
person
semana
who
fazendo
is engaging in
esse tipo de
ecotourism,
lazer,
they spend the
retorna à sua casa,
weekend
né?
doing this kind
E
of
aí,
leisure, this
onde
kind of
também
tourism
alertou para isso, né? O
activity, and they
período
come back
em que
home.
essas pessoas são
So the
infectantes
period
para o
in which
mosquito,
these
falou
people
muito
may
bem,
infect the
obrigado
mosquito,
também
as
ele,
was
do
mentioned before.
processo
Thank you very much for
de que
your clarifications before.
O
in
vírus
your
necessita de
presentation
tempo
before,
dentro do
and the
vetor, ou seja, esse período de
process by which
incubação
the
que
virus
tem no
needs an
vetor
incubation
tem
period
período
in the
de
vector.
dias entre 7 a 10
There is
dias
a certain
para que
amount of
isso ocorra, depende
days,
de
7 to
condições
10 days
ambientais
for that
também,
to
de
happen. It
temperatura, de
depends
umidade,
on the
que podem acelerar
environmental
ou diminuir esse processo,
conditions, which
mas se a gente
may either
tiver em
speed
torno de
up
7 a 10 dias,
or
você
slow
vê que
down the process. So if
desde a detecção,
the
se
period
temos
from
uma
the
investigação
7 to
rápida
10
e essa
days from
investigação
detection, and
conclui
if
que
the
esse sim é um
detection is
caso
timely,
que
and if
teve
the
numa
detection
área que pode ser um risco
concludes that
de
this is a case of
estar
a person who
portando
visited
vírus,
an
a
area
intervenção
that
nessas áreas é
of a
essencial.
person
Na casa desse
who
paciente,
of a
na
person who
unidade
visited
de
a place
saúde que
and
ele
really
pode ter
might
eventualmente
be harboring
visitado,
the
no seu
virus,
local
then
de trabalho,
intervention is key.
que nós estamos
Going to
falando
that
aí
person's
entre o
workplace, going to the
período
places
de
that person might
primeiros
have
sintomas, o
visited.
período que ele
Now
necessita
we're
para
speaking about the time frame
detectar,
between
de se sentir
first
mal e ir ao
symptoms,
hospital e
when the
ele
person
nesse
starts
período está
feeling
se
sick and
expondo
they
a
go
esses
to
vetores que
hospital.
podem estar nesse
In the
ambiente urbano.
meantime,
Local de
other
trabalho,
people may
escola,
be
universidade, ou seja,
exposed
são
to the
locais
vectors
típicos de
that might
trânsito
have
das
been
pessoas.
reintroduced
E
into
em
the
essas
urban
áreas, a recomendação
scenario.
é que se faça o
In
controle dos
such areas,
adultos,
the
né, através da
recommendation is
aplicação de
controlling
inseticida
adults
espacial ou residual e
using
o controle dos
residual or
criadores em uma
topical
faixa
application of
ao redor
insecticides and controlling any possible breeding grounds in a
desses imóveis
belt
que podem estar no
around
mínimo de
the
200 metros. Esse seria
specific area of at
uma
least
primeira
200
recomendação. Se bem
meters
que
in girth.
no nível local sempre há uma descrição
This is
maior e
the
pode
recommendation.
esse
Of
raio
course,
pode aumentar ou
locally,
diminuir de acordo
this
com
the
as
girth of this
capacidades
circle might be a
operativas
bit bigger,
dos
depending on
programas de
local
resposta, nos programas de
recommendations,
controle de vetores.
depends on the
Tema muito
size of
importante aí
the
também que a
program
gente
and
tem que
what they consider
trazer
technically.
são essas
Another
manchas
important
verdes que nós
issue
temos
is
nos
the
ambientes urbanos, que são os
green
parques e
areas
os
in
zoológicos,
urban
né? Essas
environments,
são
which are
áreas em que
zoos and
podem
parks. These are places
albergar,
that
como já foi dito aqui
might
também,
harbor,
não
as was
só
said before
esses
as well,
vetores,
not
no
only
caso
these
Aedes,
two
mais o Aedes
vectors,
albopictus, e algumas vezes o Aedes aegypti,
Aedes
mas também
albopictus, more
vetores silvestres. Então, a
preponderantly, sometimes
vigilância
Aedes
desses
aegyptis,
vetores
and
nessas áreas é
also
essencial para que se possa também,
wild
tendo
vectors.
uma
So
análise,
vigilance in
uma
these areas
avaliação
is
técnica
absolutely
na
key
factibilidade e necessidade, implementar
when you have a
também
technical
dentro de uma
analysis of the
razoabilidade técnica, a
need
atividade de controle, seja de
and
adultos, de criadores,
importance is
ou de
implementing
acesso a
also
essas áreas. Isso
control or
é essencial
access
para
measures.
diminuir o
This is
risco de uma
very
transmissão ou
important
prevenir o
to
risco dessa
decrease
transmissão.
or prevent
A
the
resposta da
risk of
organização, a
prevention.
resposta da
The
entomologia, ela tem
answer
se
of
calcado em alguns
entomology
pontos
to these
importantes. Um
cases
é a
has been
transferência da
based on
capacidade
a few
em
important
treinamento de pessoal, ou seja,
issues.
vários técnicos
Firstly,
estão
capacity
desenvolvendo
building
ações de
for the
vigilância e
work
controle,
teams,
as melhores práticas,
always
apoiar os
always
processos de
adopting best
análise
practices, giving
integrada
support
desses
to
dados. Os
analytical
colegas falaram, por exemplo,
integrated
hoje
data
na edição
analyses
desse
of these
alerta. Isso é
cases.
essencial para que
Of my colleagues
todas as
spoke
ações
about
de
that.
vigilância e
This
controle
is
estejam
key to understand that all
prontas
of the
para serem
vigilance and
implementadas,
control
assessorias
actions
técnicas
are
de
ready to be
investigação
implemented,
e trabalho em rede, né?
technical
Se trabalham com seus
investigation, and
colaboradores
also
e principalmente com
networks,
duas
working
redes
with
que nós estamos
collaborated and
promovendo na
especially with
região.
two
Uma
networks, which
muito
we are
importante, que é
promoting
aquela
right now. The
relacionada à
first is
detecção de
very
vírus em
important,
mosquito, e uma
which is
segunda que
detection of
trata da
viruses
resistência a
in mosquitoes.
inseticidas.
And the second network
Lembrem-se que eu estou
is
falando de
resistance to
utilizar
insecticides. And always bear in mind
inseticidas
that I
para o
am
controle
speaking about
rápido de
using
uma eventual um risco
insecticides
de transmissão
for
urbana.
the
Então,
prompt control
utilizar
and
aqueles produtos que são
prevention of
realmente
urban outbreaks.
efetivos
Using
fator
products that
chave
are
nesse
really
momento de
effective is absolutely
implementar
key
essas ações. Não
in
só
when we
eles
are
sejam efetivos,
putting
mas
these
que
actions
as pessoas sejam
into
devidamente capacitadas, técnicos que
in
estão
place.
operando, e que
So
os
the people must
equipamentos estejam
have
em boa
had their capacities built,
boas
the
condições e
equipment
calibrados
must
para
be
poder fazer
calibrated in
essas ações
working
de controle.
conditions to make sure
Para
that
as
these
perspectivas que
control
nós temos para
activities are
fortalecer essa área de
efficacious.
vigilância e controle
Now, our
dos
perspectives of
vetores que estão
strengthening the
associados à
vigilance
transmissão da
and
febre amarela,
control of vectors
seja no ambiente
in
silvestre ou
transmission of
aquelas
yellow
que
fevers,
podem
either in
estar no
wooded
ambiente
areas
urbano,
or urban
aumentar a
areas.
capacidade da vigilância
Firstly
entomológica
is
nesses dois entornos. Esse é um fator importante para
capacity
todos.
building of
Apoiar o desenho de
entomological vigilance in these two scenarios.
sistematizados
This is
e
important
padronizados para a
also to
vigilância
support the
e que isso
design
seja
of
critério para
systematic and
desencadear a
standardized
resposta,
procedures,
desenhar e difundir
and make sure that
melhores
this is a
práticas,
criteria
né? Nós
for
temos
answering
muitos,
the possible outbreaks,
muitas
design
entomologistas que estão trabalhando nessa área, muitos
and
programas que têm desenvolvido e que têm
disseminate
aportado com práticas
programs.
muito
Several
interessantes e que
entomologists have
são
designed
cada
very
vez
interesting
mais
programs with
operativas
very
para ajudar nesse
interesting
processo de estudar melhor esses
guidelines,
vetores,
and
ou
they're very
tanto aqueles que
important in the
não temos
process of
tanta
studying
informação
the
como aqueles que já
vector,
temos
even
algumas,
those
e fortalecer
on
a
which we don't have
coordenação
that
entre
much
os
information.
entes
And lastly,
envolvidos. Aqui eu coloquei
strengthen
entre o Ministério da Saúde, mas
coordination
pode
between
ser entre
actors. I
qualquer
said
dos
Ministry of Health
sócios
on
ou
screen,
parceiros
but
que estão envolvidos
any
nessa
actors,
resposta, com os
any
centros de investigação para
party
fortalecer
with
a geração de evidências e
strengthening
que
their
ajude ao tomador
cooperations
de
with these
decisão na
centers
implementação das
that
melhores
generate
práticas de
evidence for decision
prevenção,
making
vigilância e
to
controle.
help
Quero agradecer
decision
a todos,
making, the
obrigado. Mais uma
decision
vez
makers to make the
estou à
right choice.
disposição para
Thank you,
qualquer
everyone.
pergunta.
I'm
Obrigado.
at your disposal for
Muchísimas gracias,
any
Devolvo a
Haroldo.
palavra.
observations
Muchas
or
gracias,
questions.
Haroldo. Y definitivamente un componente clave, por supuesto, no solo para entender, sino para poder facilitar el control de la fiebre amarilla y claramente completamente articulado con los demás componentes. Tenemos, igual estábamos programados para hacer el seminario, este webinario, hasta las 11:30 hora aquí de Washington. Todavía el tiempo va pasando y por eso les voy a pedir que por favor las preguntas las traten de contestar directamente en el Q&A, porque tal vez no vamos a tener tiempo para responderlas en vivo, pero pienso que igual el tema es prioritario y por eso queremos continuar y por supuesto cubrir todos los temas pertinentes. Y uno de ellos es precisamente el diagnóstico clínico y el manejo clínico de la fiebre amarilla, que por supuesto es lo que puede hacer la diferencia entre una buena sospecha clínica y un buen manejo precisamente para evitar una mortalidad. Para eso entonces invitamos al doctor Ángel Rodríguez. El doctor Ángel Rodríguez es el asesor de manejo clínico de riesgos infecciosos de la Unidad de Gestión de Amenazas Infecciosas del Departamento de Emergencias de Salud de OPS, de la Oficina Regional en Washington. Y Ángel nos va a hablar precisamente entonces del componente clínico y manejo de la fiebre amarilla. Ángel, por favor, adelante. La presentación se va muy bien, así es que por favor, adelante.
Gracias, Jairo, colegas, muy buenos días a todos. Bueno, me voy a centrar realmente en los mensajes principales y por supuesto las diapositivas serán disponibles para ustedes y podemos seguir bilateralmente en caso se requiera, ¿ok? Esta es la estructura de la presentación. La presentación está creada con base en experiencia de los países de la región que han presentado casos y han manejado casos entre 2016 y 2021 con un grupo de expertos que trabajó en estas guías, pero también con la experiencia específicamente de Brasil y Colombia en estos brotes de 2024-2025. Y la estructura de la presentación va muy ligada a las recomendaciones de la organización, ¿no? Entonces, la primera es acerca del fortalecimiento de la detección temprana del caso. Ya hemos, en este seminario, se ha hablado de definiciones de caso y de otras acciones, el tema de la vacunación, del manejo del vector, etcétera. Y yo creo acá lo que queremos resaltar es básicamente esta especificidad de la enfermedad, ¿no? Y esto es una cita del doctor Ramalho donde especifica que la fiebre amarilla es el ébola en las Américas, ¿no? Es una enfermedad realmente hemorrágica que es patognomónico. Tiene 3 fases y esto está muy ligado al diagnóstico temprano, ¿no? Porque aquí ya hay elementos, síntomas, signos y otros temas de laboratorio clínico que deben de ser tomados en cuenta para identificar estos casos. Ya Renato nos hablaba, ¿no? De la identificación de casos graves en el ciclo selvático que ya es tardío y que son los pacientes que fallecen, ¿no? Con unas tasas de letalidad específica del 60%. Y aquí el mensaje clave es trabajar en definiciones específicas clínicas, más allá de la vigilancia, para identificar temprano a estos pacientes, porque síntomas, signos como la ictericia ya es tarde y es cuando el paciente ya está muy complicado, ¿no? Entonces, esto es muy importante y entrenar realmente a los pacientes. Acá un tema muy importante porque no es menor, todo el tema de la cocirculación y la enfermedad con otros arbovirus, principalmente dengue, ¿no? Cuando se menciona esta diapositiva que no es dengue, no es en el sentido negativo, es en el sentido de que, bueno, dengue también es una enfermedad, dengue grave, mata y en mayor proporción, ¿no? Que la fiebre amarilla, con lo cual sí los clínicos tienen que tener una agudeza importante para detectar criterios diferenciales de las distintas enfermedades, arbovirus principalmente, y referir a estos pacientes inmediatamente, ¿no? Entonces, en esta diapositiva ustedes pueden ver que como los síntomas iniciales de esta corte de Brasil, que son genéricos, inespecíficos, fiebre, mialgia, cefalea, astenia, etcétera, pueden ser de otros síndromes febriles, no necesariamente fiebre amarilla, y que síntomas o signos como la ictericia, hemorragia, aparecen más tarde, con lo cual no se deben utilizar como indicadores específicos de la fiebre amarilla, sino como marcadores de gravedad. Y aquí reiteramos el tema de la ictericia, ¿no? Y la hemorragia que ya aparece grave, tarde en la evolución clínica, que puede ser hasta de 7 días, cuando es fulminante de 4, ¿no? Entonces, la identificación temprana es muy importante para la toma de muestra y las pruebas diferenciales con otros virus como arbovirus, pero no necesariamente con otros arbovirus también hay que hacer la diferencial, pero también hay otro diferencial con otros procesos clínicos, ¿no? En esta tabla que está acá y está, por supuesto, también en la guía, se ponen otras situaciones clínicas que pueden presentar estos síntomas no necesariamente infecciosos, ¿no? Y aquí es importante fortalecer la capacidad del laboratorio clínico, más allá del laboratorio virológico de referencia que Lionel nos hablará más tarde, y tener realmente diagnósticos diferenciales con los arbovirus, pero también con malaria, con leptospirosis y otras bacterias, donde es muy importante contar con el laboratorio, pero bueno, también en la investigación de brote que ya nos comentaba Mark, que también Renato habló, Haroldo habló. Importante muy bien la historia clínica, ¿no? Las exposiciones, los contextos epidemiológicos, la ausencia o no de vacunación, etcétera, ¿ok? Y también tomar estos algoritmos que ya están muy claros y muy definidos para esto, ¿no? Siguiendo con este tema, reforzando el tema del laboratorio clínico, porque no solo es un tema de manejo clínico del paciente, ¿no? Donde no, es una enfermedad que no tiene un tratamiento específico, que se tiene que manejar de manera integral, de soporte, tratación principalmente, y manejo y de las complicaciones y prevención de la hemorragia. Pero acá el tema de los servicios sanitarios es muy importante, no es menor porque hay 3 niveles de atención que se recomiendan dependiendo del caso, lo vamos a ver en las siguientes, pero muchas veces el nivel primario no tiene realmente el acceso a este laboratorio clínico y los pacientes tienen que ser tratados y referidos al segundo nivel, aun cuando estén leves o moderados, y más aún cuando es grave a un tercer nivel. Y aquí solamente en esta diapositiva resaltar lo mínimo esencial que se requiere en un hospital para dar el seguimiento y la evaluación de un paciente con sospecha de fiebre amarilla, ¿no? Como puede ser la biometría hemática, química sanguínea, el acceso a laboratorios de referencia con capacidad viral y después de las pruebas clínicas de rutina que muchas veces en estos lugares remotos no se encuentran. Y entonces es muy importante crear esta capacidad porque cuando un paciente es referido y es grave, son horas en cuanto fallece y muchas veces fallece en el traslado cuando no se llegó realmente a evaluar correctamente. Entonces, acá el mensaje es, no solamente es el diagnóstico, no solamente es el tratamiento, sino también la capacidad de los servicios de salud, la organización y la capacidad del laboratorio clínico para tener acceso al monitoreo y ayuda clínica. Y esto está relacionado con lo siguiente, ¿no? Ya se habló de esta pirámide donde la gran mayoría de los pacientes pueden ser leves o asintomáticos y los casos graves son los que acuden al servicio y de atención y tienen que ser identificados tempranamente. Y aquí ya están los signos de alarma de estos cuando evidentemente es una zona urbana y con acceso a un hospital de segundo o tercer nivel es fácil, pero una zona remota no tanto, ¿no? Entonces hay que valorar todo el tema de las enzimas hepáticas, por supuesto, la función renal y signos y síntomas muy específicos como es el dolor abdominal, el vómito, ¿no? El tema del mareo, el sangrado, por ejemplo, epistaxis, otros, y la oliguria, ¿no? Aquí hay una
Others. And here
clasificación que se
we
verá mejor en la
have the
siguiente
classification. You
diapositiva
can see
acerca de
this
los niveles de
classification
tensión, las acciones
that is better
concretas
explained in
y
this slide
lo que se
with
recomienda,
the
¿no? Y aquí
actions
dos
and the
mensajes claves en esta
recommendations. And
diapositiva.
here
Uno,
there are
en el
two
caso de la
key
experiencia de Brasil,
messages in the
donde
case of
los
the
colegas
Brazilian
míos reconocen,
experience, where
donde
our
realmente en este
colleagues
brote del
recognize
2017
that
el nivel
in this
primario
outbreak
no
in
se utilizó porque no existía esta
2017,
capacidad
the
del
primary level
laboratorio
was not
clínico
used
o falta
because
del
we didn't
recurso
have this
humano
capacity of the
o
clinical
de
laboratory. There
entrenamiento
was a
también.
lack of human
Entonces se
resources,
tomó
a
la
lack of
decisión de referir
training,
inmediatamente a
and
un
the
segundo o un
decision
tercer
was
nivel
to
y con
refer the
eso
patient to a
disminuyó
second or third
la
level,
letalidad, por
and
supuesto. Y
with
el
this,
otro
the
tema de
lethality
este
rate
mensaje es no
decreased.
esperar a que la
And
ictericia
the
aparezca, ya
message, the
es
key message
tarde, ¿ok?
here, we
Entonces,
should not
esto es muy
wait
importante y
until the
ahí
jaundice
la
C
clave es
appears. This
esperar,
is
como
very
siempre, ese
important, and the key
laboratorio,
message
¿no?
here
Leonardo nos va a
is to
especificar
have a
a
good
esto porque
laboratory
necesitamos realmente del diagnóstico de la
capacity.
fiebre
We
amarilla, pero
do need
también de otros
the
diferenciales para
diagnosis
tomar acciones
and other
concretas. Y este
differentials to
cuadro que está en la alerta
make
epidemiológica del día de
specific
ayer,
decisions.
no
And
voy a entrar
this
en
graph
detalle,
that was
divide los
also
pacientes
shown
en tres fases,
yesterday. And
¿no? Tres
here we
grupos
have the
A, B y
division
C,
of patients
dependiendo
into three
su
groups, A, B,
gravedad
and
y
C,
con la
according to
condición
their
clínica que pueden
severity
ver
and the
aquí,
clinical
¿no?
condition. You can see here
Un síndrome
this
genérico,
syndrome,
¿no?
generic
Donde
syndrome, where
hay que
we
evaluar cada
have,
24
we need
horas,
to
tener
assess every 24
laboratorio,
hours.
dar
We need to
hidratación,
have
manejar
a
el dolor,
laboratory. We need to manage the
etcétera.
pain. We need
Evidentemente, en
to
todo caso,
manage all
aquí
the
evitar los
symptoms. We need to
medicamentos
prevent
antiinflamatorios no esteroideos, ¿no? Y después
anti-inflammatory
ya lo
drugs.
habéis dicho en la
And
anterior, ¿no? Si no
then
hay capacidad
I repeat
a
again,
nivel y
if
hay
we
una
don't
sospecha
have a
clara por
first
el
level
texto, por el
capacity and we
contexto,
have a
por
clear
la
suspicion because
situación
of a context,
epidemiológica,
because of the epidemiological
el
situation
antecedente laboral,
of
etcétera,
the occupational
es mejor
background,
enviar al segundo nivel para tener un tratamiento
we
mayor
should
avanzado,
better
manejar los
take the
volúmenes,
patient to the second level to
monitorear
manage the
los
volumes,
órganos
to
específicos y
monitor
ver
the
los
specific
indicadores de
organs,
gravedad y en
and to
caso que se
see
compliquen pasarlo a
the
una unidad de terapia
severity
intensiva donde ya se
indicators
tiene que manejar
before
el daño
going
orgánico
to
más
the
allá de la
intensive
hemorragia, por
care
ejemplo, ¿no? Y en
unit
este
to
sentido,
manage the
resaltar una vez todo el tema de la coordinación
hemorrhagic
y organizaciones
cases. And
listas en respuesta
also,
al
we
brote,
need to
¿ok?
manage the
Porque
services
no
to
es solo
respond to
el
the
manejo
outbreak, because
del
this is not
paciente.
only
Aquí se
about the
recomienda tener un
management of the
comité
patient. And
nacional que
here, the
investigue,
recommendation is to
responda
have a
esto y
national
maneje todos los
committee
componentes
to
que ya
manage all the
Andrea
components
Vicari puso al
that
principio de
Andrea
que es una
Vicari
respuesta. Y esto
already
incluye la adaptación de los
mentioned as
protocolos
a
clínicos,
response,
el
and this
entrenamiento a
includes
los profesionales
the
de salud,
training on clinical
específicamente en estos
protocols, the
aspectos,
training of health
tratamiento del
professionals,
caso, prevención y
especially
control de la
for the
infección
treatment
y
of
manejar la red,
case, the
manejar la
prevention and
red de
control of
servicios de
infection, and also
referencia,
to manage the reference
tener ambulancias
network, to
listas,
have
prontas,
the
cuando se
ambulances
requieran,
that are
pero
ready
más
when
importante,
required. But the
prepararse y
most
crear
important
capacidad en niveles
here
locales donde
is
no la tienen
to
y tienen que
have a
identificar tempranamente en
preparedness
caso de
in those
referir
places where
cuando las
they
distancias
don't
son
have
bastante
the
largas, ¿no? Y
resources,
por esto
especially
el
when we
tema
have long
de los servicios,
distances.
¿no?
And that's why
Definir
we are
hospitales de
highlighting here the
referencia,
topic of
tener,
services, to
garantizar que
define
haya camas
reference
disponibles en
hospitals, to
UCI y
guarantee
todos los
the availability
insumos
of beds
necesarios
in
para
the
contar con el
intensive care
tratamiento del
units and
paciente.
all the
Y
supplies
aquí están,
for treating
esta
the
diapositiva
patient.
And
ya en el
here
caso grave,
you can
es
see
muy
a severe
importante
case. It is
manejar estas
extremely
acciones, ¿no? Que
important
están
to
aquí,
manage all these actions, to
específicamente el
adopt all
tema
these
de
actions.
monitoreo de la
We have the
coagulación,
intensive
el
monitoring
tema del
of
tratamiento
coagulation, the
con hemodirá o
treatment with
hemoterapia, ¿no?
immunity,
Y aquí me gustaría
immunotherapy.
resaltar dos
And I would
cosas.
like to
Uno,
highlight
los
two things
predictores de
here.
riesgo, ¿no? El riesgo
The
hacia letalidad
risk
está
predictors,
acá, es básicamente la
which
edad,
are
¿no? La
here,
edad
predicting
adultos
mortality
mayores que
risks.
aumenta cada con 5
Here
años,
with
el tema tema de las
older
enzimas
people, every
hepáticas
2
arriba
years,
de
we have an
1800,
increase of
¿no?
the risk.
La aminotransferasa, la creatinina, por supuesto, y
Aminotransferase,
el INR, ¿no? La coagulopatía
the
mayor de 1.5. Estos
INR
criterios tienen que
above
estar
1.5.
evaluados
All these
y
criteria
evaluar a
need
estos pacientes
to
para
be
poder dar un
assessed
tratamiento
to assess the
específico o
patients
no.
to
Como mencionaba antes, no hay un
adopt any
tratamiento
specific
específico.
treatment. We
Los
don't have a
antivirales como
specific treatment. Antivirals
ribavirina no tienen realmente una evidencia
do not
sólida
have
para
really
esto y se
solid
utilizan en
evidence
situaciones
for these
experimentales, ¿no?
specific cases. We have to
El
work with
intercambio plasmático también
experimentation.
se
The
usa
plasmatic change also
de
is
manera
used
experimental, pero bueno, hay experiencias
on
como
an
conté ahora
experimental
en migrañas
level,
con uno de los
but we have
expertos
different
que fue
experiences
con la
with
plasmaféresis
different
que también se
experts.
puede utilizar. Y el trasplante hepático
The
la respuesta de
liver
Brasil, bueno,
transplant
realmente
also
no
with
se
the response
recomienda
of Brazil is
debido
not
a estos
recommended
resultados, ¿no?
due to these
Eh,
results.
Vuelvo a
Once
insistir en
again, I
el
want to
tema
highlight,
de
to
laboratorio
insist
clínico
on the
y el
clinical
manejo del
laboratory
paciente ya
and the
grave
clinical management
por
of the
lo que se necesita para los
patient with
exámenes
a
de
severe
laboratorio
case.
y el
We need
manejo
lab
de las
testing, we
complicaciones,
need
¿no?
to
Como la acidosis,
manage all any
prevenir
complications, we need to
daño
prevent
neurológico, prevenir
the
las
neurological
convulsiones
damage,
y por supuesto el sangrado
convulsions, seizures,
masivo, que es lo
and bleeding.
patognomónico y lo importante de esto, con
This is very
acciones concretas,
important. With
tratamientos que están
specific
ahí y con
actions,
una
specific
infraestructura
treatments,
necesaria
with
como
the
para dar hemodiálisis
appropriate
principalmente, y
infrastructure,
medicamentos, tener en el stock
and we need
medicamentos
to have a
como
stock of
levetiracetam, la
drugs
cosamida para la
such as
profilaxis de estas
cosamide
convulsiones,
to
omeprazol y
treat
todo el
the
tema
seizures,
medicamentos contra la anticoagulación
all
y
these
intercambio
drugs
plasmático, ¿ok?
for
Esto lo
the
dejamos acá y
anticoagulation.
básicamente voy a concluir con tres mensajes
I want to
claves.
finish with 3 key
Uno es
messages.
que
One
esta
being
enfermedad progresa muy
that this
rápido, ¿no?
disease
Entre 7 días, 4
growth
días, y
increase
una vez
very
que ya hay
easily.
un sangrado
1, 2,
importante,
3, 7 days.
ictericia,
Once there is
etcétera,
an
es una cuestión
important
entre 4 y
bleeding,
8 horas, con lo
we
cual
have
identificar
7,
temprano al
8 hours
paciente
in which we
con
need
un
to
buen diagnóstico
identify the
diferencial, manejar los
case with a
volúmenes, iniciar un tratamiento,
differential
sobre todo
diagnosis.
referir a un
We need to
segundo
decide
o
on
a
the
un tercer
treatment,
nivel que es
maybe a
prioritario,
referral to a second or
organizar
third level.
los
We need
servicios
to
para
organize
respuesta
the
en situación de
services, the
brote,
response
garantizando no
services
solo las camas,
regarding outbreak
la terapia, pero
response.
también
We need to
las
organize the
ambulancias y también
therapy,
el tema de la referencia
ambulances, the
pronta.
referral
Y lo
issue
último
also is
es lo
important.
que
And
estamos
lastly,
trabajando, ¿no? La
what we are
guía
working on, these
que
guidelines
presento ahora en
that
nombre
I
de
am
este grupo tiene aspectos
presenting
del nivel primario, secundario,
with
pero aún hay
primary
un
and secondary
trabajo que hacer
level
en el manejo
aspects.
del paciente
There's
crítico.
work to do
Entonces,
regarding
hemos
the
convocado
treatment
un
of the
grupo de expertos
critical
que está en curso para hacer
patient.
estas
We
guías
have
de manejo clínico
gathered a group of
crítico del paciente en
experts,
UCI que esperamos que puedan servir a disminuir la
experts on
letalidad
the treatment
cuando las
of
otras
the
medidas que son prioritarias
intensive care unit patients
no han sido efectivas, ¿no?
when the
Eso
other
sería
measures
todo.
have not
De
been
regreso a ti, Jairo,
effective.
por
I
supuesto.
give you the floor,
Gracias.
Jairo.
Podemos seguir
Thank you very
bilateralmente y
much.
reconocer el
We can
trabajo de todos estos
continue the
expertos.
conversations
Y
after the
especial mención para la doctora
meeting.
Ho
And thank you very
Yeli, el
much to
doctor Darío
Dr.
Brock
Ho
y
and
Rodrigo
Daria
Said
Broke
de
and
OPAS,
Rodrigo
que
said
están
it,
liderando la parte
who
técnica clínica en esto y colaborando
are
para estas
managing the
guías de este proceso.
clinical,
Nuevamente,
the
gracias a todos
technical
y un saludo.
part of this work. Thank you,
Muchísimas gracias,
everybody.
Ángel.
Thank you very much,
Definitivamente un aspecto
Angel.
clave aprender
Indeed, a key aspect we need to
aún con
learn
tanta experiencia, pero como tú lo
with
dices, hay tantas
all your
enfermedades
experience. As you
arbovirales
said, there are so
y
many
otras
arboviral diseases
patógenos que
and
pueden
other
similar,
pathogens
que
that
son
are
similares a la fiebre
similar
amarilla, que
to the
realmente hay que
yellow
aprender
fever disease. We need
a,
to
diagnosticarla
learn to
clínicamente, porque
diagnose,
eso, insisto, puede hacer
to
la diferencia
to
entre un
have
tratamiento
a
adecuado o no,
proper
y por
diagnosis,
supuesto salvar la
because
vida
this
de un
can make the
paciente.
difference
Vamos a hacer un
regarding
ajuste en
the
la agenda por
treatment.
reinarnos
We're
del
going to
tiempo
adjust
y le
our
voy a pasar la palabra
agenda,
ahora. Más bien vamos
and
a
I'm
hacer
going to
primero
give the floor
la presentación sobre
to
los lineamientos regionales de vacunación
the
de la fiebre
presentation
amarilla, porque es un
regarding
tema que ha
regional
despertado
guidelines on yellow
muchísima
fever. This is a
inquietud
subject that
y
is very
definitivamente es clave para el control.
important for
Y
all of
después,
you.
con
It's
la reducción
key
del tiempo,
for
les
the
vamos a
control.
pasar otras informaciones.
And
Pero
then
para
we're going
este
to share
tema que es
some other
clave, y le
information.
agradecemos al doctor
So this is
Carlos
a
Daniel
key
Torres.
topic.
Carlos
Thank you
Daniel
very
es el
much,
asesor en
Dr. Carlos Torres, who is
inmunizaciones
the
del equipo de
advisor
vacunación para la
for
salud universal del
immunization
programa especial de inmunización
issues
integral
in the
ofrecido por
special
el primer DPS
immunization
en Washington.
program. in our office, in the PAHO office in Washington, and he's expert on yellow fever. Carlos, you have the floor. Thank you very much, Jairo. Very quickly, then, let's see the strategy, the vaccination strategies for the prevention and control of yellow fever outbreak. Some general aspects regarding routine vaccination in endemic countries, vaccination regarding outbreaks, and the split doses. Very quickly, a reminder, the vaccines for yellow fever are very sure vaccines that give humanity for the whole life, for a lifetime period. Immunity is within 30 days of vaccination, more or less. And as we said, just one single dose is enough for a lifetime. Regarding the recommendations for those endemic countries, we are talking about 13 countries in our region. The recommendations from the SAC that used to be TAC are to keep one dose in the vaccination program, this single dose in children of 12 months old. But we do know that in some countries, the program, the vaccination program, is a differentiated program. And we recommend also for at-risk areas to vaccinate susceptible or at-risk population. Another recommendation for endemic countries is that people who are going to travel abroad or that do not live in endemic areas but that are entering into endemic areas, that they receive one dose of the yellow fever vaccine at least 10 days before the travel day. For pregnant women, women that are breastfeeding, and for older population, it will depend on the recommendations of each country, but mostly if you live in endemic areas, the risk is greater. The risk of contracting the disease. We're going to talk about this later on. Regarding the vaccination strategies, and for countries at risk, the endemic countries, as we were saying, the WHO and the technical group, the advisory technical group, recommend routine vaccination among children and carrying out preventive campaigns of vaccination for the at-risk populations when there are no outbreaks, mainly in those areas that are at higher risks. If there are outbreaks in some areas, we need to carry out campaigns, of course. We're going to talk about this in next slides. And the general recommendation, as we were saying, is the vaccination of travelers that are going to endemic or to at-risk areas within their countries or abroad. Regarding the routine program of these 13 endemic countries, here we have 12 of them because one is a territory that do not report on the data. These are the last coverages that have been reported in 2023, and as you can see, very few countries do comply with the standard above 95%. If we remember what Mark was saying, this is a vaccine that does not give herd immunity. It's an individual immunity. So we need to aim to 100% of coverage. Here we're talking about children of 1 year old. Which are the strategies, the vaccination strategies regarding outbreaks? I think that this is a very important topic for those cases that, or for those countries that already have cases. First of all, we need to say that these vaccination strategies complete the other strategies, the routine vaccination, and they allow for a comprehensive response, adapting, of course, the efforts to the outbreak dynamics. This means that we need to anticipate, to be one step ahead of the outbreak, to see what the behavior of the episodic diseases is to see where this outbreak is going. In this regard, we need to carry out an assessment, a very careful risk assessment, and we need to establish, based on the vaccine availability, the priority that there may be regarding risk of contraction or the spread of the disease in those areas where the cases are occurring. We need to divide this in 3 levels: areas where there are confirmed spread or contraction. Here we need to have an intensive work, vaccination, to break this transmission chain. In this point, we need to assess the risk criteria for vaccination or not of older population, of pregnant women, and other at-risk groups. The second area is about the at-risk areas where there is no evidence of human disease, but there can be episodic diseases, so there's a high risk of spread. And here we need to work on the vaccination in these areas so that we can prevent the outbreak to spread. And the low risk areas are those areas in which there aren't any episodic disease reported. In an inter-epidemic periods, we could have update campaigns among those populations that, because of their work activities, enter sylvatic areas or jungle areas. So it is very important to be aware of the corridors where there are non-human primates, where there are episodic diseases, so that we can vaccinate those people that are vulnerable and avoid the spread of the outbreak. What do we need to do in these cases? Once the outbreak is there, and there are different cases that are reported, we need to assess the risk. We need to identify where these cases are, and once again, we need to see where the episodic events are occurring to extend this vaccination area. We need to define our target area, population, sorry. We need to know who we need to carry out the vaccination campaign with. One single dose of the vaccine, once again, immunity, lifetime immunity, and we need to see which are those groups that are at the higher risk, those populations that are in close contact in the areas where the cases are reported, mainly in these outbreaks that we are having currently in the jungle, mainly. The calculation of the needs, we need to carry out a regular control on a regular basis of our vaccine stock. We need to take into account that the response in the outbreak, we need to see what the stock is regarding the syringes as well. We need to see what the stock of vaccines are and the availability of the cold chain is as well, to make sure that we can conserve the vaccines. We need to mobilize human resources, logistical resources, transport resources, and also food resources. We need to carry out a continuous analysis of risk benefits among all these populations. We need to see if we are going to carry out the campaigns for populations older or younger than 6 months old. Are we going to carry out these campaigns in people over 60 years old, in pregnant people, or people or women that are breastfeeding, in case that these people live or they have to enter a area that is at risk. We need to assess if we need to carry out a vaccination campaign among these people. We need to carry out analysis on a regular basis to see if we need to vaccinate these groups or not. So we need to reinforce the surveillance, not only when we are vaccinating these groups, but once we are carrying out a campaign as a response to an outbreak. Why? Because we are vaccinating more people, a greater number of people in a short period of time. So the cases may, or the effects may seem to multiplicate, and this gives us the perception that there is a higher risk regarding the vaccine. We need to be able to respond to these situations that may raise concern among the population. We need to identify which are the areas in which we are vaccinating the at-risk population, the population that is working, that is mobilizing, that is going from one place to the other. We need to make sure that we have reached those people that were not previously vaccinated. We need to see which are the areas where we need to go again so that we can plan for our interventions in those areas. And as we were saying, always we need to be aware of the stock, of the vaccine stock in the sector at a national level as well. Why? Because we may need to make decisions based on the extension of the outbreak. When we have a limited use of vaccines, a limited stock of vaccines, we may need to interrupt the vaccination activities in those areas that don't present much risk. So there we need to carry out an analysis, an assessment. This interruption could be just temporary, so that these doses can be used in those areas in which the cases are reported. And if these doses are not enough, maybe we can use split doses. In this regard, the use of split doses in response to an outbreak must respond to two conditions. First of all, once an outbreak occurs and the supply is limited, the vaccine supply is limited. We have the recommendation from the shelf, that is the advisory group of the WHO and the strategic advisory group of the PAHO, SAC currently, used to be called GTA. They recommend the use of split doses, the fifth of the standard dose. For this, of course, we need to be trained, the staff need to be trained regarding regulations, so that they all know that the split dose vaccination is not something recommended for those children under 2 years old, for people at risk, for pregnant women, for travelers, for international travelers. This is something we need to be aware of. Regarding the planning aspects, we need to guarantee the availability of the syringes that will allow for these split doses to be applied 0.1 ml, and the needle needs to be the correct one for the application that is going to be subcutaneously. These syringes we use are limited to 0.5 usually, so we need to plan accordingly so that we have the correct needles, and this way we will be able to limit any waste regarding the vaccines. The information system needs to be adapted as well. This information system is going to be used to enter all the data, the follow-up of the users. We're going to know which people have received this split dose. In the case of international travelers, they need to receive the complete dose. This regarding the international health regulations. And regarding communication, we need to have a communication plan, risk plan. It has been proved that the split dose does give immunity regarding yellow fever, and therefore we need to address in a correct manner any concerns that the community may have. Regarding risk assessment of people that do not necessarily have any contraindications, in a context of outbreak, the vaccination for people above 60 years old, pregnant women, women breastfeeding, children under 6 or 9 months, all there needs to be a very detailed risk-benefit analysis, because in older people there may be a greater risk of severe SAVI. So we need to take into account the risk of exposure. If these people live or travel because of their work into areas in which the outbreaks are reported, of course, in these cases, the risk of infection is greater than a post-vaccine SAVI, when there hasn't been any previous vaccination against yellow fever. Of course, in this case, we may vaccinate, and if the infection risk, as we were saying, if the person is going to be exposed in an area where there is active transmission, of course, in those cases, we should consider vaccination of these people. And this is the analysis that has been carried out by the ministries of health in Colombia and in Brazil to vaccinate these populations, mostly older people, and custom medical assessment to see what the immunological status of these people is. If we see that the exposure risk is high, in that case, we need to vaccinate. But if there are any comorbidities or high risk of SAVI, we need to strengthen maybe preventive uses without any drugs, even though we do need that these are less effective than the vaccine. And in all the cases, we need to strengthen SAVI surveillance, mainly to detect in a timely manner, in an early manner, any severe SAVI. The vaccination is not contraindicated in older people, but we need to take into account all these elements, all these clinical criteria before vaccinating these people so that they can give their informed consent. They can be aware of all the benefits of vaccination and the possible effects. Of course, all these has to come together with a very good communication, risk communication plan. We need to inform the population of the places where they can get their vaccines. Most of the population is a population that works, and sometimes during vaccination campaigns, they are not on the field because, or in the place because they are working.
So we need to raise
no se percibe
awareness
ese
regarding
riesgo
the
y
risks
por tanto
of this
no
disease.
se visualiza la necesidad de
People
la
many times
vacunación.
are
Por
not
tanto,
aware of
es
this.
importante
So it is
indicar a
important
la población, informar
to
muy bien lo que está ocurriendo y
communicate
la
all the
necesidad de
to
recibir
inform the
esa
population
vacuna.
of what is
¿Por
going on
qué?
and why
Porque
it is important
generalmente,
to
sobre todo cuando
be
no hay una buena
vaccinated.
comunicación de riesgo y se
When there
presentan
is
algunos
no good
ESAVIs,
risk communication
se
and
debe
there and
reforzar
some
la
SAVs
confianza en la
appear,
vacunación,
we need to
porque si no la
strengthen the
conducta va a ser el
confidence
rechazo
in
a la
the
misma.
vaccine.
En ese
Otherwise, the
sentido es
population is going to
importante
reject
abordar
the
estos
vaccination, the
cuellos de
vaccine.
botella,
So
como
it
decía
is
anteriormente,
important
con
to
una buena
address all
capacitación del
these topics
personal de
with a
salud
good
para que pueda dar
training for
la
our
respuesta
health
adecuada
personnel
a
so
las
they can
preocupaciones
give
que pueda
a
tener la
proper
comunidad
response
y
to any
también
concerns the
informar
population may
a la
have and
comunidad
to inform
previamente sobre
the
todos estos
community about
eventos a
all
fin de
these
que
events
pueda haber una mayor
so that there
recepción.
can
Y
be
también
so that
ampliar
the
incluso
vaccine
en
can be
cuanto a lo
better
programático, los horarios de
received.
vacunación,
We need
adaptarse
to
a la realidad
schedule all the
económica de
vaccination
esas comunidades, porque muchas veces las brigadas van en el
plan
momento en
times.
que los
Sometimes the
pobladores están
vaccination
en
groups
sus
go
labores
to
y
these areas
obviamente las
when
coberturas
the
persisten bajas y lo que
population is
sigue
working, so the
ocurriendo son
coverage
nuevos
remains
casos. Entonces, se
low
deben
and we have more
realmente
and
estas
more
barreras
cases. So all these obstacles
ser
must
resueltas
be
con antelación,
overcome
sabiendo muy bien cuál es la dinámica
previously,
económica
knowing which the
de la
economic
población
dynamic
y
is
también
for this population,
tener un
and
adecuado manejo de
we
la
need
infodemia para
to have
poder
a good
contrarrestar
management of the
cualquier
infodemic
desinformación o
to tackle
malinformación que
any
pueda haber.
misinformation there
Con
may be.
esto, bueno, y poniendo a disposición algunos de los recursos que ya también
These are some of the
algunos de
resources
los
that we
colegas han
have.
señalado anteriormente,
Some of my colleagues
termino
have
esta presentación
already
y quedo atento a
shown you
sus
this.
preguntas.
If you have any
Carlos.
questions, please do not hesitate.
Muchísimas gracias, Carlos, por
Thank
la
you very
excelente
much, Carlos,
presentación.
for this excellent
Me presento, soy el
presentation.
doctor Lionel Gresh de la Unidad de
I'm
Gestión de
Dr.
Amenazas Infecciosas y
Lesh
estoy
from
reemplazando
the
acá
Infectious
al
Hazard
doctor Jairo Méndez,
Management
que tuvo que
Unit.
salir
I'm replacing Dr.
a
Jairo Mendez
una
that had to
reunión
leave to a
urgente.
meeting, a very urgent
Bueno, quería
meeting.
darles
I
primero las
wanted, first
gracias
of all,
a
to
todos los
say
panelistas por
thank you to all
sus
the
excelentes
panelists
presentaciones.
for your
Nos
very
hemos
good
extendido un poco más de lo que habíamos
presentations.
inicialmente planificado, pero
We are
creo que
taking
el
more
tema,
time
además
that we
de
had
su relevancia
planned for, but
para la salud
this is a very
de nuestras
important
poblaciones,
topic
es realmente
for our
apasionante.
populations.
La
This is a
presentación
very
que
passionate
teníamos
topic. The
prevista
presentation
para
we had
el
planned for
laboratorio la vamos
the
a
lab,
posponer
we are
y
going to postpone it,
probablemente tocarla en un marco donde también
maybe
incluyamos
for
aspectos de
another
vigilancia
space in which
genómica
we can include
del virus de la fiebre amarilla.
exotopic disease
Antes
surveillance.
de cerrar, quería resaltar que
Before
tanto la información
closing this webinar, I
epidemiológica
wanted to highlight
actualizada
that all
como
the
las
epidemiological
recomendaciones
information that is
que
up to
están,
date and all the
las
recommendations
recomendaciones de la OPS, recomendaciones
of
principales por
PAHO
componente y las referencias a los
by
documentos clave
component, all the
que donde se abordan estas
references to key
recomendaciones están
documents
disponibles en la
are
alerta
available in the
epidemiológica que les compartimos en
epidemiological
el chat
letter
y
that we
cuya
shared in
última
the chat
versión fue
box.
publicada
And
ayer,
the last version of
el
this
día
was
de ayer.
published yesterday.
Señalar además que
I would like to
este
say
webinario
that
es
this
parte de una
webinar
serie de
is
webinarios que
part
desde la Unidad de
of a
Gestión de
series of
Amenazas Infecciosas
webinars
estamos
that
organizando,
from our
que tendrán
IHM
acceso
unit
a
we
la
are
grabación
organizing.
en
You will be
breve
able to
y que
access
el
the
próximo
recording of
webinario que
this
estaremos
webinar, and the
organizando
next
en 2
webinar
semanas va a
is going to
tocar
take
temas
place
de
in 2
virus
weeks.
respiratorios, en
And we are
particular el del virus
going to focus on
del COVID
respiratory issues
y
regarding COVID.
que, como les comentaba,
As
los aspectos de
I was
vigilancia de
saying, the
laboratorio de la fiebre
surveillance
amarilla sean
aspect of
tocados
laboratory surveillance for
en otra
fever,
ocasión.
for
Con
yellow
esto,
fever
darle las gracias de
is going to
nuevo
be
a
addressed
todos
in
los
another webinar.
panelistas
So once again,
y
thank you
a
very
todos los
much to all our
participantes
panelists,
por habernos
to all our
acompañado en esta
participants for being
importante sesión
here
en el día
in
de
this
hoy.
very important webinar.